Hey guys, waiting for this to be live. So I've opened this on my phone. So let me make sure it's live. If you can hear me, especially this part, just give me a thumbs up so that I know that they started streaming. There's usually a lag. So today we are going to be doing cranial nerves, a part that was left from yesterday. If you haven't watched part 2 of Anatomy Basics Head and Neck, you must, because there I've explained the trigeminal nerve and the facial nerve in exactly the way it is required. And okay, yeah, so now I can see that we are live. So I have explained these two topics there exactly in the way they are required. And if you haven't seen the first part, that's okay, you can still see the second part. There is no continuity per se, but do definitely spend 3 hours and watch those parts because they'll give you a very holistic idea of the cranial nerves, right? So I'll just wait for 1 or 2 minutes for more people to join. So if somebody's watching, do send me a hello or something so that I can make out. Anyways, so I'll continue with my presentation. So welcome to Let's Crack NEET PG, the YouTube channel of Unacademy NEET PG examination, where you'll have the top educators, some of the qualitiest content which you'll see today as well, and you'll have a great learning experience. That is my assurance to you. Good evening, Bele Ame. How are you? Right. So, as I do it, my class starts with a mnemonic for the day. And yesterday, I had told you this mnemonic, but I wanted to present it again because it's a very important question for your professional examinations. The mnemonic is O Tom Cat, right? And the way you have to write this is OTOM, and cat is written this way, right? So O Tom Cat. And this is the relation of the structures in the cavernous sinus. So here you have the oculomotor nerve, the trochlear nerve, the ophthalmic division of the trigeminal nerve, and the maxillary division, right? In between you have the carotid artery running, the internal carotid artery, and inside it you have the abducens nerve, right? So you might have heard of a little something called as pulsating exophthalmos, all right? Even if you haven't, what does it mean? It means that the artery here, this artery here, since it is present inside this pool of venous blood, if this ruptures from here, so whenever the heart pumps blood, it goes into the artery and there is a beat in the artery, and because of that, there is a sudden inflow of blood into the cavernous sinus. And because the cavernous sinus is so closely related to the eye, so because of that, you have the continuous bulging of the eyeball, known as pulsating exophthalmos. Right. Okay. So, it Beliame. So, did you watch part one for this? Let's move on. So, my name is Chetanya Mittal. I am a third semester, that is second professional MBBS student at All India Institute of Medical Sciences, AIMS, New Delhi, India's best medical college. My rank in the AIMS examination was 4, rank in the JIPMER examination was 5, and I also have the KVPY and NTSC scholarships. My plus referral code, guys, is Chaitanya10, that is my name, and 10 after that. So the important thing I want to tell you about is the plus subscription of Unacademy. And if you want to know more about my classes, you can join the Telegram channel at the rate NEET PG Chetanya, and I'll be taking a few more classes. So I'm planning to take blood vessels of the head and neck. I'm planning to make adrenergic receptor functions easy for you, and through cartoons, right? So I hope you guys would like that. So I'll just give you a quick recap of what we did yesterday. So we started with the basic concepts of the cranial nerves. Before that, I'd like to tell you about the Unacademy Plus subscription. So as you can see, these are all the courses that are there on the Unacademy Plus for NEET PG, and you can see all of these are locked. Now, why are they locked? Because these can be accessed with the PG subscription that can be taken, and there are a few special classes for which you need to download the app. You can also give these mock tests that are there, and there is a new feature of doing these mock tests live. So you will have a flexible schedule. You can learn in whatever language you want. इंग्लिश में सीखना है इंग्लिश में सीखो. हिंदी वाले एजुकेटर्स हैं हिंदी में भी पढ़ाते हैं, मैं भी हिंदी में पढ़ा सकता हूँ, दैट्स नॉट एन इशू. और अनलिमिटेड प्रैक्टिस करो मॉक टेस्ट की, क्वेश्चंस की, ठीक है. एकदम लगेगा क्लासरूम में हो, चैट कर सकते हो मेरे साथ. तो यू कैन स्टिल बी राइटिंग समथिंग हियर इन द लाइव chat. I am seeing what you're writing, and you can send me a hi, you can ask your doubts here, and interactive polls, and you can basically learn anytime. All right, so that's the best thing. So this is all you have to do. Go to the Play Store, download the Unacademy app, go for the NEET PG subscription. I would recommend you take the 1 year or the 2 year plans, ठीक है, because economic पढ़ते हैं. अब ये देखो, ये 5,000 per month है और ये almost 1/3, ठीक है. And this is lesser than the amount that you would spend on your outing, so it's definitely something you should do for yourself. एंड यहाँ पे एक ऑप्शन आएगी एंटर रेफरल कोड. यहाँ पे बस मेरा नाम और 10 डाल देना, चैतन्या 10, ठीक है. सो यू विल स्ट्रेट अवे फर्स्ट ईयर गेट अ 10% ऑफ, तो यहाँ पे सीधा लग जाएगा. उसके अलावा इफ यू हैव सम लर्निंग क्रेडिट्स यू कैन रिडीम दिस एंड यू विल गेट एन एक्स्ट्रा 10% ऑफ. तो मतलब मेरे कोड के साथ बेसिकली 20% ऑफ मिल जाएगा. एंड दिस इज नॉट ओनली फॉर नीट पीजी, दिस ऑल्सो अप्लाइज फॉर नीट यूजी, यूपीएससी और एनी अदर कोर्स दैट यू आर टेकिंग अ सब्सक्रिप्शन. तो बस ये अप्लाई हुआ. एंड आई अश्योर यू, अगर मेरा कोड यूज करते हो, जस्ट कॉन्टैक्ट मी, आई विल डेफिनेटली गिव यू सम मोर पर्क्स. So yeah, and now the final thing I want to talk to you about is the NEET PG iconic subscription of Unacademy. As you know, Unacademy, India's largest online learning platform. So Unacademy Plus के अलावा एक तुमने चीज सुनी होगी पीजी प्रेप के लिए, प्रेप लैडर. सो एज यू नो, Unacademy has acquired प्रेप लैडर. तो प्रेप लैडर की भी सब्सक्रिप्शन मिल जाएगी और अनअकैडमी प्लस की भी मिल जाएंगी. तो बस इसके अलावा कुछ चाहिए ही नहीं होगा, ठीक है. इसमें बहुत सारे अच्छे टीचर्स हैं, जैसे जीआरजी सर फार्मा पढ़ाते हैं उस पर. एंड यू कैन टेक द 3 year सब्सक्रिप्शन फॉर दिस, बेस्ट इफ यू आर इन द सेकंड ईयर, एंड इट विल ओनली कॉस्ट यू 82,800, right? And if you use my referral code, you are here straight away getting 10,000 off, and just contact me, I'll give you more discount. And if you have learning credits, you can get another 10% off. So yesterday, so now let's move to the class. This is my referral code. ये हो गई promotion. अब let's talk about what all we did yesterday. So these were some high yield facts जो आपके सीधा सीधा MCQs आएंगे. Question 1 is the longest nerve, shortest nerve, longest intracranial course, longest intradural course, longest intraosseous course, thickest nerve and thinnest nerve. ठीक है, तो ये 7 questions done. उसके बाद I told you some statements to remember. Alright, and ये आज हम अच्छे से डिटेल में डिस्कस करने वाले हैं. So I'm not going into the detail, but ये याद रखना, all pharyngeal muscles bivagus except one, that is stylopharyngeus, and there is also a tensor palati. So these are supplied by the ninth and the mandibular nerves. All tongue muscles by hypoglossus, extrinsic and intrinsic, except one muscle, palatoglossus. All laryngeal muscles by recurrent laryngeal nerve, except one muscle, that is cricothyroid muscle, which is supplied by the external laryngeal nerve. And this is the sensory supply. You can leave this for right now. So we talked about the first, second, third, fourth, sixth pharyngeal arches and what are their respective nerves. So there is an arch, there is a nerve, and when we do the blood vessels, you will also find out that there is an artery for every pharyngeal arch. ठीक है, तो जैसे इस डायग्राम में दिख रहा है, there is an artery, there is a nerve, and there is a cartilaginous mesenchyme for every pharyngeal arch. And this is the diagram I told you, very important for your prof examinations, very important for your PG examinations, and very important for any entrance, because this is the basic concept of the brainstem. Cranial nerve number 1, it will be running here, that is the olfactory nerve. They have not shown it. The second nerve crosses here, optic chiasma. Third nerve emerges from the interpeduncular fossa. Trochlear nerve coming from the dorsal surface. This is here the trigeminal nerve. The small is the motor root, the large is the sensory root. Why is the motor root small? Because it only goes with the mandibular division. Then 6, 7, 8, मेरे को 6, 7, 8 बनाना बहुत अच्छा लगता है, मजा आता है. And then here you draw the 9th, you draw the 10th, you draw the cranial root of accessory and the spinal root of accessory. The 12th comes out from between the pyramid, and the olive. Very simple diagram. Okay. Then we talked about the columns. So you have the general somatic efferent, where I told you, remember, the extraocular muscles and the tongue. They are the only parts which have to be innervated here. Then special visceral efferent, you have the pharyngeal arch nerves. Then general visceral efferent, you will have all your parasympathetic supply, third, seventh, ninth, and 10th cranial nerves. Then special visceral afferent and general visceral afferent, they are by the nucleus tractus solitarius. Here you will have the gustatory nucleus as well as the nucleus for the general visceral afferent, that is your baroreflex. Then you have the general somatic afferent, which is completely by the nucleus of trigeminal. And okay, thank you, Arushi. And then you have a special somatic afferent where you will have the vestibular nucleus and the cochlear nucleus. So to get an idea, you should look at the section of the brainstem. So let's go for cranial nerves 1 to 13. Now, which was the 13th nerve? I told you yesterday. Yeah, so the nervus terminalis. Nervus terminalis is the 13th cranial nerve, and I told you that it is related to the smell mediated sexual behavior. So sometimes it so happens that you really like the smell of a person, and that induces some sexual behavior. So it is believed that it is mediated via the nervus terminalis. So that's about this. And then when you move to the olfactory nerve, right? So the olfactory nerve, we talked about this basic pathway, and I have made this flowchart for each of the cranial nerves. Just draw these in your professional examination and remember these for your PG examinations, because this is the course of the nerve. So the olfactory receptor, olfactory nerves are formed. Here's the cribriform plate, alright. So this is the skull, and here this part is the cribriform plate where you have a projection here called the crista galli. Alright. Then it pierces the cribriform plate, enters the olfactory bulb, then moves to the olfactory tract, divides into the olfactory stria, and goes to Brodmann area 34, which is the primary olfactory cortex consisting of these four structures: the uncus, the entorhinal area, the Lyman insulae, and the amygdaloid body. Alright. After this, you can have some emotional associations based on olfactory association. Second, optic nerve. You remember the entire course. There is a pathway that goes to the cortex, the lateral, which goes through the thalamus. So that is the geniculocalcarine radiation. And I'll also be talking at the end of today's lecture about the lesions of the optic nerve. Alright. And then there are some pathways that go to the midbrain for your various reflexes. Right. Third, fourth, sixth cranial nerves supply your respective muscles. Mnemonic is solar, and you write SO4 LR6. Cool. Then you have the median longitudinal fasciculus collecting all these muscles. Then talking about the course of the oculomotor nerve, it passes through the cavernous sinus between the posterior cerebral and the superior cerebral arteries, and it also gives a branch which comes from the Edinger-Westphal nucleus to supply the sphincter pupillae and the ciliaris. Trochlear nerve supplies a single muscle. Superior oblique comes from the contralateral nucleus. Abducens nerve passes in the Dorello's canal, and it is related to the petroclinoid ligament. It has the longest intradural course because of its passage here. What is the second content of the Dorello's canal? It is the intrapetrosal venous. Then we talked about the parasympathetic ganglion. So there is ciliary ganglion, pterygopalatine ganglion, and submandibular and otic ganglion. Otic ganglion will supply the parotid, submandibular will supply the submandibular and sublingual. Trigeminal nerve, principal sensory nucleus, this is at the level of the pons, this is at the level of the midbrain, and this is at the level of the medulla oblongata, and it extends up to the C2 level in the spinal cord. Right? So you have the motor nucleus in the pons itself. So there are a total of 4 nuclei of trigeminal. Then we talked about the course here. I hope you remember the ophthalmic had 3 divisions: frontal, nasociliary, and lacrimal. The maxillary continued forward as the infraorbital and gave the superior alveolar branches, posterior, middle, and anterior. Cool. So mandibular nerve, there are a few branches which come directly from the trunk. Then it divides into the anterior and posterior divisions. Posterior division is larger. It gives the auriculotemporal and lingual sensory nerves, and it also gives an inferior alveolar nerve giving a branch to mylohyoid and anterior belly of digastric. Facial nerve, largest intraosseous course. Why? Because it is present in the facial canal. Largest intradural course was abducens. Why? Because it was present in Dorello's canal. So it is the longest intraosseous course because it is present in the facial canal. There is some neurobiotaxis involved here. Okay, then I talked about the injuries. Every time you just add one additional loss of feature, and You can refer to yesterday's video for a detailed discussion of which level facial injury will lead to which. So let's start with today's class. So this is the first MCQ for today. The nerve of the sixth arch is question number 1. So just write question number 1 and your answer. Don't even write Q, just write 1A if your answer is A, 1B, 1C or 1D. Right, so I'm waiting for your answers, guys. Right. So Himanshu Rateria and Bele Ame both have given the correct answers. Very good. Good answers. Answer is vagus. Nerve of first arch is mandibular. Second arch is facial. Third arch is glossopharyngeal. Fourth, fifth, and sixth is fifth disappears actually. Fourth and sixth. So question number 2. The tensor tympani is supplied by which of the following nerves? Tensor tympani. So it's a muscle related to your tympanic area, that is your middle ear, tensor tympani. It is supplied by which nerve? Question number 2. Yes. So Himanshu Rateria said the answer is trigeminal. Absolutely correct. Tensor tympani muscle will be supplied by the mandibular nerves of mandibular division of Himanshu. Question number 3. It is basically same as the previous question, so I'm not giving you time to answer it. Which of the following muscle is the derivative of the first arch? Answer will be tensor tympani. Why? Because it is supplied by the mandibular nerve. So that's a very good way to remember that. So this is a very good interrelation. You can remember through this the muscles of which arch are which, and you can also remember that the nerve supply of which muscle is which. So that is why this concept of pharyngeal arches is something I really like. Then moving to vestibulocochlear nerve. Moving to vestibulocochlear nerve. So the vestibular and the cochlear nerve in the pons and medulla. This is today's topic, so we are starting fresh now. So where do they originate, right? So remember we had drawn the section of the brainstem. This was your midbrain, right, with the interpeduncular fossa. Then you had your pons and you had your medulla. This was your pontomedullary junction. Okay. तो इधर से दो नर्व्स इमर्ज कर तीन नर्व्स इमर्ज करी थी राइट कौन सी सिक्स्थ सेवंथ एंड एट्थ यहाँ से आई जस्ट ड्रॉ सिक्स्थ seventh and eighth. So eighth was basically coming in the junction between pons and medulla, right? At the cerebellopontine angle. Why is this called as the cerebellopontine angle? Because यहाँ पे पीछे posteriorly you will have the cerebellum. So this angle is known as the CP angle. Here you also have a cistern. You also have a cistern. Cistern is a collection of CSF. तो cerebellopontine angle पर निकलेगी. There is also a cerebellomedullary cistern which will be present on the posterior surface. See, if this is the back, so here upper you have the midbrain, then you have the pons, here you have the medulla. So imagine the cerebellum is attached something like this. Alright, it is present behind the pons and it is connected by the cerebellar peduncles. Now, between this medulla, so if this was the back of the brainstem and this is the cerebellum, so there is a space formed here, right? And that is the cerebellomedullary cistern, which is the collection of CSF. Alright, and here you do the cerebellomedullary cistern is the place where sometimes you take the CSF if the lumbar puncture is not possible. So you pass the needle through above the atlas, right? and it goes into the cerebellomedullary cistern. Okay, so then here the vestibulocochlear nerve, it emerges from here, and then here you have the internal acoustic meatus where it enters along with the facial nerve, right? So remember I told you a mnemonic for this arrangement. Then it enters the internal acoustic meatus and it divides into two branches, the cochlear nerve and the vestibular nerve. The vestibular nerve will further divide into the superior vestibular and inferior vestibular after the vestibular ganglion. Okay, so I'll tell you a mnemonic quickly. Okay, you guys can listen to the mnemonic. You missed it yesterday because it is very relevant here. First, what are the structures? What are the structures passing through the internal auditory meatus? All right. So I will write. There are three structures, rather four structures. So if I write the vestibular nerve and the cochlear nerve separately, then you know the facial nerve passes through, and then I am leaving one content here blank. So you can tell me the fourth structure in the comments. What is the fourth structure that I have not written here? What is the fourth structure that passes through the internal acoustic meatus, right? And the relations in the internal acoustic meatus, the nervous relations, those are the ones that I'll be telling you. So let me take a different color. Let me just take this green color. So imagine this is your internal acoustic meatus, right? It has these four contents. Now what are the nervous relations of these contents? So there is basically, I will divide it into four. So this vertical ridge, this is known as Bill's bar. All right, this has been asked in the AIMS examination one. Bill's bar. Okay, not very important. Horizontally, it is divided by the falciform crest. Again, not very important for your prof discussion. So here you will have 7 Up and Coke. What is left? Vestibular, right? So superior vestibular and inferior vestibular. Superior vestibular nerve, inferior vestibular nerve. Now what is 7 Up? 7 here is the seventh cranial nerve, that is the facial nerve. And what is Coke? Coke, cochlear. Alright, so Coke is the cochlear nerve. This is how your vestibulocochlear nerve is present, and here you will have the 7 Up, that is the facial nerve. So one content that I had not written, I hope someone can tell me in the chat what is the another content of the internal acoustic meatus. Alright, otherwise we'll come to it later. I'm waiting for a fast answer to this question. Contents of the internal acoustic meatus. Right. So now let's move to the next nerve. So we are done with cranial nerve number 1 to 8 is done, and we've also done 13. So now what is left? 9, 10, 11. These are the only cranial nerves that are. So now let's start with the glossopharyngeal nerve. Let's start with the glossopharyngeal. So glossopharyngeal nerve, remember, it had all nuclear columns except the first and the last. What was the first column? The general somatic efferent. So it does not have general somatic efferent. Why? Because it does not supply the extraocular muscles or the tongue. All right, and it does not have special somatic afferent. Why? Because neither does it bring the fibers of vision, nor does it bring the fibers of olfaction, and nor does it bring the fibers of listening or hearing or balance. All right, and those are the special somatic senses. Besides that, it will have all nucleus. So nucleus ambiguous is your motor nucleus. Nucleus tractus solitarius has your gustatory fibers, right? So it has both special visceral afferent and general visceral afferent. The inferior salivatory nucleus will give you the general visceral efferent, the parasympathetic supply for which gland? Parotid gland. Final nucleus of trigeminal will bring the general sensations, right? So this is the general somatic afferent, GS. So these are all the columns that are present. The first and the last column. Remember that there was a structure here, and there was 1, 2, 3, 4, 5, 6, 7 types of columns. So except this and this, all are present. And what is the fun thing? That glossopharyngeal nerve and the vagus nerve, they have the same columns. Both of them have 5 columns. So where does the glossopharyngeal nerve emerge? Right? So it was emerging between the olive and the inferior cerebellar peduncle. Now if I go back to this diagram, so it was emerging here, right? If you remember 9th, 10th and 11th. So this is the pyramid, and laterally you have the olives, right? And here posteriorly you have the cerebellum. Okay, I'll draw this diagram again. Yes, Himanshu Rotaria is absolutely correct. Labyrinthine artery is the content. Labyrinthine artery is the content of internal acoustic meatus. That was right. So interpeduncular fossa is the midbrain. This is the pons. This is the medulla. So here you will have the pyramids. These are the pyramids. Why? Because the cortico spinal tract known as the pyramidal fibers, they are passing here. So this elevation is known as the pyramid. On the side you have the olive. Why? Because here you have the olivary nucleus complex. So if the structure passes from here, this is the glossopharyngeal nerve. Posteriorly, like I told you, you will have the cerebellum. You will have the cerebellum. I show you this. It is present as a dorsal extension, right? So this is the cerebellum. It's present behind, right? And so this was the cerebellopontine angle, and here it is connected via the inferior cerebral, the middle cerebral, and the superior cerebral peduncles. So now this becomes the junction between the olive and the inferior cerebellar peduncle, where this nerve emerges. Then it goes posteriorly into what is known as the jugular foramen. It is into jugular foramen. So jugular foramen, very important. We will also do the contents of the jugular foramen today, right? So you should remember the 9th, 10th and 11th nerves pass through the jugular foramen, not the 12th. Okay. So after moving out from the jugular foramen, you have two ganglia that are present in the foramen. One is the superior ganglion and the second is the inferior ganglion. So the superior ganglion, these are the ganglia of the glossopharyngeal nerve. Similarly, you will see that the vagus also has a superior ganglion and an inferior ganglion, right? And the inferior ganglion is giving a tympanic branch. It is giving a tympanic branch, which you know is known as the Jacobson's nerve, and it forms the tympanic plexus. Major contribution to tympanic plexus comes from that nerve, right? So superior ganglion hai, inferior ganglion hai, and then there is a carotid branch. Now, can anybody tell me what does this carotid branch do? It is known as the nerve of herring. Why? Because one of its branches is the nerve of the herring, because it mediates the baroreflex. Why is it important? Because it mediates the baroreflex and the chemoreflex, right? So you remember the glossopharyngeal goes and supplies the carotid sinus and the carotid body. So this is the nerve of herring. Then what it does after it has given these branches, what would you do as a UG aspirant? You like my way of teaching? Thank you so much. Hopefully meet you at AIMS next year. And then you have this nerve, the glossopharyngeal nerve, which passes absolutely correct. Absolutely correct. It supplies the carotid chemoreceptor and the baroreceptor. Now see, there are two things. One is the carotid body and one is the carotid sinus. Can you tell me which is the baroreceptor and which is the chemoreceptor? Because there is, I used to tend to forget which is the chemoreceptor and which is the baroreceptor. Okay, so tell me, is carotid body a chemoreceptor or a baroreceptor? So then this passes between the ICA and the IJV, right? So it passes between the internal carotid artery and the internal jugular vein. They're present inside the carotid sheath. They're present inside the carotid sheath. Or am I wrong? Yes. The sinus is the baroreceptor and the body is the chemoreceptor. Absolutely correct concept, Akash Saha, bang on. Right? So after it is moving here, so let's imagine a little. It exited here from the jugular foramen. Alright, you will not be able to appreciate it through this webcam. And after it moves out, you have a styloid process here, right? So this is the styloid process here, and you have a muscle which goes to the pharynx. So it goes like this, right? There's a muscle which goes like this. Just follow my hand and if index finger and my thumb. This muscle will be going like this, and the glossopharyngeal nerve, it moves along its posterior border. ठीक है, उसका पीछा करती है ये. Why does it follow it? Because it wants to supply it. Because it wants to supply it very desperately. And which muscle will this be? The stylopharyngeus. Because this is the only muscle that comes from the third arch. This is the only muscle that comes from the third arch. right? So stylopharyngeus is, so it gives a muscular branch to the stylopharyngeus as it accompanies it, and then it passes between the superior and middle constrictors while doing so. And when it passes between these two muscles, it gives a branch to your tonsil. So now a person has enlarged tonsil. A person has enlarged tonsil, and it gives a lingual branch. These are minor branches. Most important is this and this branch. Okay. Now can you tell me कि अच्छा ये मैं एक बार इसका orientation दे दूँ pharynx का. So let's say this is your pharynx. So do you know that in your pharynx you have these three circular muscles? The superior constrictor overlapped by the inferior constrictor or middle constrictor, and overlapped by the inferior constrictor, right? So these are the three constrictor muscles, and here you will have the base of the skull. You will have the base of the skull. I'm drawing a schematic. There are a few structures. So this is the superior constrictor, this is the middle constrictor, and this is the inferior constrictor. There are a few structures that pass through here. There are a few structures which pass through here. There are a few structures which pass through here. And niche, you will have the esophagus. You will have the esophageal tube. And there are a few structures which pass upward from here. Alright, so I will cover in the lecture on pharynx what all are these structures. But let me tell you these four sets of structures, very important for your prof. Okay. Right. So highest marks in the NEET 2020 are according to me 720. Time. I've heard a news of someone having 720 marks there. Now let's move to the course of the glossopharyngeal ones. So as you can know, it has a nucleus in the ninth, and then it has a nucleus. It has a motor nucleus, right, which is part of the nucleus ambiguous, which is part of the nucleus ambiguous, and it also has structures coming from the inferior salivatory nucleus. So we'll just see all of those. If you see the ninth nerve coming here, what is the only muscle that it will supply? That is the stylopharyngeus. What are the other structures that it will supply? Tonsil. Now gustatory fibers from the posterior one third of the tongue and general sensation from the posterior one third of the tongue also come through this. And always remember, from the anterior one third you have some papilla known as the circumvallate papilla. They are also supplied by the glossopharyngeal nerve, not by the facial nerve. So I will write here posterior one third of the tongue and the circumvallate papilla. They are supplied by the glossopharyngeal nerve. These two things, and plus the general sensation from the posterior one third of the tongue. Sorry, I said two third. Is meant to be one third. Then you have this nerve of herring, which will supply the carotid body and carotid sinus. Baroreflex is a 10 marks question in your prof. Straight away would definitely come in your prof examinations. Then you will have this tympanic branch, which forms the tympanic plexus, also known as the Jacobson's nerve. So I told you there are three nerves from the 7th, 9th, and 10th which are related to the ear. The 7th has the quadrant tympani there. The 9th has the Jacobson nerve. 10th has the Alterman's nerve. Okay, and they are somewhat, all of them have something related to the ear. Then after the tympanic plexus, it forms the lesser petrosal nerve, which exits the cranial fossa, middle cranial fossa, via the foramen ovale, enters into the otic ganglion. Now where is the otic ganglion present? Along the mandibular nerve, right? And the otic ganglion is somewhere here. Then it moves with the uh, zygomatic nerve, right? So basically, after this, there is a course that is a little complicated, okay, with which it reaches the parotid gland, ठीक है. तो एक चीज मैं यहाँ पे क्लियर करना चाहता हूँ, क्योंकि मुझे थोड़ा कंफ्यूजन होता था कभी कभी. Now glossopharyngeal nerve supplies the parotid gland, and the facial nerve supplies the submandibular and the sublingual gland. Now the confusing thing here is that this is present superiorly and this is present inferiorly, but this is supplied by the inferior salivatory nucleus and this is supplied by the superior salivatory nucleus. No, not the zygomatico-temporal. I made a mistake. It was not the zygomatic nerve here, right? That's for the lacrimal fibers. That's for the lacrimal fibers. And the lacrimal fibers, they are by the facial nerve, right? Here, through the otic ganglion, the auriculotemporal nerve, right? So these fibers will go with the auriculotemporal nerve, right? Which is a division, which is a branch of the posterior division of the mandibular nerve. So they will accompany the auriculotemporal nerve, which will supply, yeah, right. The lacrimal is gives a branch is given through the zygomaticotemporal nerve, and the parotid gets a branch from the auriculotemporal nerve. There is some reinnervation that can also supply the sweat glands. ठीक है, अब देखो ये चीज है, इसको मैं समझाता हूँ क्या है. Now this is known as the phrase syndrome. Very important, phrase syndrome, also known as the auriculotemporal nerve syndrome. Now, I hope you remember that what was crocodile tear syndrome first of all. Okay. Crocodile tear syndrome क्या था? Was it related to which nerve? It was related to the facial nerve. Lesion of facial nerve proximal to the geniculate ganglion, where you had a reinnervation. Okay. So what happened? That the fibers, that the parasympathetic fibers that the facial nerve was carrying for the submandibular and the sublingual glands, and it was also carrying fibers of the lacrimal gland. So there is a damage to the greater petrosal nerve. It regenerates, and sometimes that regeneration is not accurate. Sometimes that regeneration is not accurate, and because of that inaccurate regeneration, you will have tears coming when you eat food. Right? So that is the crocodile tears. Now, what is Frey syndrome? Frey syndrome, someone has very correctly written, Akash Saha has written correctly, that it is the gustatory sweating. What is gustatory sweating? It means that, so there is also gustatory sweating and there is also flushing. There is also flushing. So what does this mean? It means that whenever you eat food, especially food that has the potential to give a lot of saliva, like for example strawberries or something that is rich in vitamin C, oranges, okay, that brings a lot of saliva. So when you eat that, your parotid gland has to get stimulated, and because of a reinnervation here, this auriculotemporal fibers that were meant to go to the parotid, instead they go to the sweat glands because these are also supplied by the parasympathetic division here. Okay, so because of that reinnervation, in Frey syndrome, अरे यार ये screen disappear हो गई. In the Frey syndrome, you will have reinnervation of parasympathetic fibers. Now, can you tell me? So, this will explain why there is gustatory sweating. Gustatory means when you are eating food. Now, why is there gustatory flushing? Now, what is flushing? Flushing means redness. Flushing means you will eat and your cheeks become red. ठीक है? टमाटर जैसे गाल हो गए on eating something that is sour or produces a lot of saliva. So, redness or flushing. Now, why does this happen? Because remember, the parasympathetic fibers are also vasodilators. So, what they will do, they will get wrongly reinnervated to the blood vessels and they will cause vasodilation. Because of vasodilation, you will have. Okay. So, that is the principle of Frey syndrome or auriculotemporal nerve syndrome related to the lesser petrosal nerve and the glossopharyngeal nerve and the auriculotemporal. Okay. So, that's about the Frey syndrome. There's also an incomplete Frey syndrome where you will not have the sweating, but leave that. Yes. Increased blood supply by the parasympathetic fibers, not by the sympathetic fibers, Akash. Because remember, the sympathetic fibers are vasomotor, so they will cause vasoconstriction in the peripheral areas, and the parasympathetic fibers are vasodilator for the peripheral. So now it's time to move to the vagus nerve. Okay. So let me know if everything is clear so far, and then we will move on to the vagus nerve. आकाश ही बताएगा। सब समझ आ रहा है आकाश अभी तक? Now let's move on to the vagus nerve. Vagus nerve very important as you all know, but the good part is head and neck में बहुत ज़्यादा नहीं है इधर, है ना? ये मतलब है but उतनी नहीं है जितनी overall है. Okay, right Akash, thank you. So now I'll have to change the ink color. So vagus nerve, I told you it has the same columns as the glossopharyngeal nerve. It has the same columns as the glossopharyngeal nerve. So what all will it not have? It will not have the general somatic efferent because it does not supply the extraocular muscles or the tongue, right? So it will first of all not have the general somatic efferent. Second, what will it not have? It will not have it will not have the special somatic efferent. It will not have general somatic efferent and special somatic, right? So what all will it have? So it will have the nucleus ambiguous, which gives it the motor branches, right? Then you will have a dorsal nucleus of vagus, which is exclusively for the vagus, which has some supply. I will tell you about it. And then you will have the nucleus tractus solitarius, which is having your general visceral and the special visceral afferents. This is for the taste. This is for the baroreflex. This is for your special visceral efferent, and you have the dorsal nucleus of vagus. So if you can recall, the dorsal nucleus of vagus is giving you the innervation that is efferent in nature. So it is giving you the general visceral efferent, yeah, and which is the one column that is left. There is one column that is left. So the general somatic efferent, right? That is the one that is left right now. So we'll come to that. That goes to the trigeminal nucleus. Okay. So vagus nerve, it emerges at the posterolateral sulcus. So this part of the brainstem, you were having the ninth nerve emerging, you were having the 10th nerve, and you were having the 11th nerve. So this place is the posterolateral sulcus. This whole thing is the posterolateral sulcus, and it then moves into the jugular foramen. So I just told you the contents of the jugular foramen are the ninth, 10th, and 11th cranial nerves. Moves into the jugular foramen, and it forms two ganglions here. One is the superior ganglion and the other is the inferior ganglion. Now, what is the role of the superior ganglion? Superior ganglion does two things. It gives a meningeal branch. Remember, the vagus gives a meningeal branch and it supplies the meninges in the infratentorial region. ठीक है? तो infratentorial, supratentorial एक बार देख लो. I'm not going into the detail of the nerve supply of the dura, but it is very important for the understanding of headache. थोड़ा गड़बड़ बन गया. This is your anterior cranial fossa, this is your middle cranial fossa, and here you'll have the posterior cranial. So here you have a fold of cerebrum or the dura mater known as the fox cerebri, है ना? And here you have fox cerebelli. In between them, you have this sheet known as the tentorium cerebelli, which is attached here to the anterior clinoid processes. Okay, so you have this sheet known as the tentorium cerebelli, on which you have the occipital lobes resting, and you will have the superior surface. So here, if the brain is there, you will have the occipital lobe here, and here you will have the cerebellum. So you will have the superior surface of the cerebellum. This is why it is known as the tentorium cerebelli, because it is a tent over the cerebellum. And the dura is also present in this way. So there is a supratentorial dura and there is infratentorial dura. So mostly here it is supplied by vagus. Here it is supplied by trigeminal, also supplied. This all is also supplied by other cranial nerves. But I won't go into the detail of it. So, but if there is a lesion of the trigeminal or there is some neuralgia related to the trigeminal, it will usually have a headache in the this portion because this is the supratentorial region. The dura is the one which is responsible for your headache. And if it is in the inferior portion, let's say you have it in the infratentorial region, it's generally related to the, if there is a, let's say, an inflammation or a meningitis of this region, you will have an infratentorial headache. So it also gives an auricular branch, right? It is a small branch, the auricular branch, but you have to remember that this is known as the Alderman's nerve, or the there's another name for it from A. So you have to find out that. So it's auricular, Alderman's, and there's one more name with A. So that is about this, the auricular branch. But it is important because sometimes it is asked that the a part of the auricle, it is supplied by the vagus. Okay, so outer part is mainly supplied by the vagus and the facial, and as you go inner, it is mainly supplied by the glossopharyngeal. So it is either known as the Alderman's or it is known as the Arnold's nerve. Okay, it is either known as the Alderman's or the Arnold's nerve. Okay. And then you have the inferior ganglion, which is known as the nodose ganglion. So you might have heard this name, nodose ganglion. After that, it goes in the neck between the ICA, that is the internal carotid artery, and the internal jugular vein. So as you know, the glossopharyngeal, it also follows the same course. So glossopharyngeal and vagus, for now, they have the same course. Inferior ganglion, it gives a lot of branches. So the superior ganglion was giving only a meningeal and the auricular branch. Here, inferior ganglion gives some important branches. First of all, it gives a pharyngeal branch to supply the pharynx, obviously. Then it gives a branch to the carotid body. Now the branch to the carotid body and the whole aortic system, right? So your baroreflex portion, that is being mediated by vagus here, so it gives a branch to your blood vessels. Okay, so it mainly the aortic body and the baroreflex related to the aorta, they are supplied by the vagus. And then you have the superior laryngeal nerve. You will have the superior laryngeal nerve, which further divides into the external laryngeal and recurrent laryngeal, not recurrent, internal laryngeal nerves. So the external laryngeal nerve, it supplies a muscle, that is the cricothyroid. It supplies a muscle called the cricothyroid, and the internal laryngeal nerve, it pierces the thyroid membrane, enters inside, and supplies the mucosa above the level of the vocal cords. Then after the inferior ganglion, the vagus nerve, it continues into the neck between the artery and the vein. It gives a branch to your heart known as the cervical cardiac branch in the neck, and it also gives a branch that is known as the recurrent laryngeal nerve. Why is it called recurrent? क्योंकि ये फिर से वापस आ रही है. So I'll tell you a little bit about this in detail. If this was your, let's say this was your superior ganglion in the jugular foramen, and this was your inferior ganglion, right? So the superior ganglion was giving two branches. One was the meningeal branch, and the second was your auricular branch. Now this ganglion here, this is giving a few branches. So it will give a branch to the pharynx, right? And then it will give you some important branches here. It gives a branch, let's say the thyroid is present here. So it will give a branch known as the superior laryngeal nerve, known as the superior laryngeal nerve to the thyroid. And this will divide into an, this is your larynx. So this will divide into an external laryngeal nerve and an internal laryngeal nerve. So the internal laryngeal nerve will enter inside and pierce the larynx, and it will supply the mucosa above the vocal cords. It will supply the mucosa above the vocal cords. The external laryngeal nerve, which continues outside, it will supply a muscle here known as the cricothyroid muscle. It is known as the cricothyroid muscle. Okay. So if I draw this in a better way, So if this is your, let's say your hyoid bone, this is your hyoid bone, and this is your thyroid cartilage. All right, so you have a thyroid cartilage in your larynx, the one that is palpable here, and then you have a cricoid cartilage, right? So the anterior lamina of the cricoid cartilage. So this is the cricoid cartilage. In between, in between, you will have here you have what is known as the thyrohyoid membrane. This is the thyrohyoid membrane, and here you will have a few muscles which are known as the cricothyroid muscles, right? So these are the cricothyroid. Now what happens? This superior laryngeal nerve that was coming, it will divide into two. It will divide into the internal laryngeal nerve, which will pierce the thyrohyoid membrane and supply the vocal cords above. It will supply the mucosa above the vocal cord, and it will give an external laryngeal nerve to supply this cricothyroid muscle, to supply the cricothyroid muscle. Now you have this vagus. So now the vagus forgets to supply all the other muscles of the larynx. ठीक है, भूल जाती है वो. Because of that, it has to come back. So it has to go to the neck, to the thorax, and it has to give a recurrent laryngeal nerve. It has to give a recurrent laryngeal nerve that will supply the mucosa below the level of the vocal cords, and it will supply all the remaining muscles of the larynx, right? And usually this recurrent branch, it is coming from, there's an artery here, and around it this goes, right? So on the right side, on the right side and on the left side there is a difference. On the left side it coils around the ligamentous arteriosus of the aorta, right, related to the aorta, and on the right side it coils around the subclavian artery. Now why that difference is there, for that you need to know a little bit of embryology. The fourth part of the, so there is some pharyngeal arteries वाला system, right, and उसमें जो fourth part होता है वो राइट साइड पे डिजेनरेट नहीं करता है, लेफ्ट साइड पे वो डिजेनरेट कर जाता है, ठीक है. तो ये सबक्लेवियन आर्टरी के साथ ऊपर खिंच जाती है और लेफ्ट साइड पे वो नीचे तक थॉरेक्स में आती है, राइट. ठीक है, तो ये एक पॉइंट है कि रिकरेंट लैरिंजियल नर्व coils around the subclavian artery on the right side and coils around the ligamentous arteriosus on the left side. So the right vagus, it descends in front of the first part of the subclavian artery, and यहाँ से vagus सामने से descend कर रही थी, सामने से descend कर रही थी and इधर descend कर दी गई और पीछे से इधर एक recurrent laryngeal. Then it goes further into the thorax and the abdomen and it gives a few branches there. So now let me have you appreciate what we talked about. What were the, what was the nerve supply in the pharynx? What was the nerve supply in the case of the pharynx? There are a lot of muscles in the pharynx, larynx, so we'll talk about that in the lecture on the larynx. So larynx की nerve supply में there are two components. There are two components. We have to talk about, yes, Akash has written correctly. We have to talk about the sensory supply and we have to talk about the motor supply. So motor, remember, all muscles are supplied by recurrent laryngeal nerve except the cricothyroid muscle, which is supplied by external laryngeal nerve. This is a branch of the superior laryngeal nerve. Sensory, you have two divisions. One is the, this is the vocal cords. So above the vocal cords, the mucosa above and mucosa below. Mucosa above is supplied by the internal laryngeal nerve, and mucosa below will be supplied by the recurrent laryngeal nerve. So these are the two concepts related to this nerve supply of the larynx. So let's continue. As you can see here, this is the right vagus. It was moving downwards. It gave a superior laryngeal nerve which gave an external laryngeal nerve and supplied the cricothyroid. Gave a recurrent laryngeal nerve which supplies all the laryngeal muscles except cricothyroid muscle. It coils around the right subclavian artery to give this recurrent laryngeal nerve. This is for the right side. On the left side, it coils around the ligamentous arteriosum across the arch of the aorta for the recurrent laryngeal nerve, and it So basically here you will see that there is also superior thyroid artery and there is a inferior thyroid artery. So I'll tell you in the blood supply that the superior thyroid artery, it is a branch of the external carotid artery, and the internal thyroid artery, it comes from the subclavian system. ठीक है, तो inferior thyroid इधर से आती है, ऊपर से आती है superior thyroid artery, and the superior thyroid artery is closely related to the external laryngeal nerve, and the internal thyroid artery is related to the recurrent laryngeal nerve. Okay, and there is a slight difference between them. There's a slight difference between them. So देखो मैं समझा देता हूँ ये चीज. ये मैंने laryngeal mucosa की सप्लाई बता दी. ऊपर इंटरनल laryngeal, नीचे recurrent laryngeal. वोकल कॉर्ड वाली भी इंटरनल laryngeal सप्लाई कर रही है. और classical head syndrome छोड़ो अभी के लिए. So if this is your thyroid, if this is your, let's say I have drawn your thyroid, this is the isthmus. This is your thyroid gland. So now I told you that your external carotid is giving a branch here. The external carotid is giving a branch here known as the superior thyroid artery. The superior thyroid artery. And from your subclavian, right, there is a branch. First, थोड़ा वो सब डिटेल में नहीं जाते, but just know that from the subclavian artery in an indirect way you have the inferior thyroid artery coming. The inferior thyroid artery. Now the superior thyroid artery, it is closely related to the external laryngeal nerve. It is closely related to the external laryngeal nerve throughout its course. Okay, but here, somewhere here, this diverges. This diverges to supply the cricothyroid muscle, and this is related to the recurrent laryngeal nerve, and the recurrent laryngeal nerve comes close to it. Okay, so while the operation in the operation of the thyroidectomy, subclavian artery की branch है, okay. In the operation for the thyroidectomy, you will have to ligate the arterial supplies, right? So you generally do not ligate the inferior thyroid arteries. Why? Because it supplies the parathyroid also. You ligate its individual glandular branches. But in case you have to do it away from the gland. Why? Because there you will not damage the recurrent laryngeal nerve. Superior thyroid artery always has to be ligated during a thyroidectomy. Alright? And you have to ligate it as close as possible to the gland. Why? Because here the external laryngeal nerve has deviated away from it. If you ligate it here, you will also injure the external laryngeal nerve. So you will injure the cricothyroid muscle. You don't want to do that. So that is why you always ligate it as close as possible to the gland. ठीक है? This is surgery का point है वैसे ये, और anatomy के clinical anatomy points में भी दिया रहता है. Now let's come to what is the Gallen's anastomosis. Yeah, थोड़ा दिमाग लगाओ, थोड़ा सा सोचो. Even if you don't know what this is, you will be able to guess it. Okay, Gallen's anastomosis. So that's question number 1 from the Vegas. So 4 people are watching for another answer. So yes, Akash has been able to guess very correctly that it is the recurrent laryngeal nerve and the internal laryngeal nerve. Now, how do you come to this conclusion? You come to this conclusion because see, here you have your larynx. ऊपर से कौन सी थी? So this was your vocal cord. So ऊपर internal laryngeal nerve was supplying, नीचे recurrent laryngeal nerve was supplying. So there is some overlapping area where there will be an anastomosis, and that is just simply known as Gallen's anastomosis. Now there is an artery, or there is a vein, sorry, there's a vein known as the great cerebral vein. Have you heard of this? Great cerebral vein. Also, it's a deep cerebral vein. Okay, and it's a little important. Why? I'll tell you. Great cerebral vein. So, write the answer. The great cerebral vein is also known as the vein of Galen. Is also known as the vein of Galen, and later you will see that the sagittal sinus, inferior sagittal sinus, it is joined by the great cerebral vein of Galen to form the great sinus. Okay, so overview दे देता हूँ. Prakash is saying the brain part is still not done. ठीक है. Don't worry, I will cover the blood supply of the brain completely. मेरे को, in fact, it is one of my favorite topics. So to give you an idea, ऊपर यहाँ पे होता है superior sagittal sinus. ठीक है. यहाँ पे नीचे थोड़ा सा होता है inferior sagittal sinus. फिर उसके बाद यहाँ पे प्रेजेंट होता है स्ट्रेट साइनस और इसमें आके ड्रेन करती है ग्रेट सेरिब्रल वेन ऑफ गैलिन. इट्स बेसिकली अ डीप वेन ऑफ योर cerebrum. So then you come to the accessory nerve. You come to, so two nerves are left, the accessory nerve and the hypoglossal nerve. इसके साथ हमारा cranial nerves का पूरा complete detailed description हो जाएगा जिसमें you will be able to have a good visualization of your whole structure of the brain. Yeah. So should we start with the accessory nerve? Is everyone up to speed till here, the vagus nerve? I'm pointing to a foramen here. I hope you can make out which foramen is this. Okay. So क्योंकि बहुत बड़ा है ना. Now tell me that if I point here, which foramen is my finger on? You make out? Not sure if you can. This is the foramen magnum. This is the foramen magnum, right? I can even pass my finger through it. Now there is a foramen which is present here. What do I show you? It is present here, right? Now here you have what is known as the hypoglossal canal. You have the hypoglossal canal. So remember the 9th, 10th and 11th. हाँ राइट, यू आर राइट मिष्टी. ये बड़ा वाला फोरामिन मैग्नम है, उसके पास यहाँ पे होता है हाइपोग्लॉसल कैनाल. एंड यू आर राइट आकाश, उसके थोड़ा आगे आपको शायद दिखा ना हो, इज द जुगुलर फोरामिन. इट इज द जुगुलर फोरामिन. Yeah, you were right in your general orientation here. I will show you all these foramen also today itself. And the accessory nerve, it has a cranial root and it has a spinal root. Cranial root means ये कहाँ से originate हो रहा है? Nucleus ambiguous of medulla, which will give its special visceral efferent fibers, which will give its efferent fibers. Alright, because it is supplying the fourth and the sixth arch. ठीक है, through the vagoaccessory complex or the vagus nerve, right? So it moves out from the anterior surface of the medulla between the olive and the ICP, similar to the little anterior and similar to the vagus, right? So that's the cranial root of accessory. There is a root on the side of the medulla that is coming like this. Now there is also a spinal root. So there is C1 to C5. There is a spinal root of the accessory, which is posterior to the ligamentum denticulata but anterior to the dorsal root. Now ये क्या बदतमीजी है, तो ये foramen magnum से enter करता है first of all and then it joins it here in the jugular foramen. Okay, चलो थोड़ा सा इसको डिटेल में देखते हैं. So now if this was your spinal cord, right? So your spinal cord has a dorsal root and a ventral root. It joins here, forms the spinal nerve and divides into the dorsal ramus and the ventral ramus. So between them, you will have this extension of the pia or dura, extension of the pia known as the ligamentum denticulata, right? You have the ligamentum denticulata. So they will run here. So it is present dorsal to the ligamentum denticulata. So these are teeth-like projections. That is why they are said denticulata. You will have the spinal root of accessory running between the dorsal root and the ligamentum denticulata. If I write with white color, then it will be more visible. Okay, I'll do that. So this is your spinal root of accessory. This is your spinal root of accessory. And this will be running upward. Is coming from C1 to C5. I hope the yellow is visible. Akash, है ना? तो ये ऊपर जब गई, it joins here with the cranial root of accessory, and for a very short time they are together in the jugular foramen. तो प्रॉपर एक्सेसरी नर्व सिर्फ जुगुलर फोरामेन में प्रेजेंट होती है. तो जैसे ही जुगुलर फोरामेन से बाहर निकलते हैं ये, दे सेपरेट अगेन. इनका जो प्यार था वो सिर्फ एक कमरे के अंदर बंद रह जाता है. क्या मतलब? ये थोड़े शर्मीले लोग हैं. स्पाइनल रूट ऑफ एक्सेसरी और क्रेनियल रूट ऑफ एक्सेसरी, दे डू नॉट मीट आउट इन दी ओपन. ऑलराइट, दे स्टे सेपरेट. दे हैव देयर सेपरेट ओरिजिन्स. अलग अलग जगहों से आते हैं, पास आते हैं, मिलते हैं जुगुलर फोरामेन में, थोड़ी देर के लिए इकट्ठे रहते हैं, बट जैसे ही वो बाहर निकलते हैं उन्हें शर्म आ जाती है और वो सेपरेट हो जाते हैं. ठीक है. So that is about the cranial root of accessory and the spinal root of accessory. Both of them have different supplies. And from here, what is the takeaway message? What is the takeaway message? यहाँ से आपको एक कंटेंट पता चल गया जुगुलर फोरामेन का, और एक कंटेंट पता चल गया फोरामेन मैग्नम का. Okay, so now you know that a content of the foramen magnum is the spinal root of accessory. ठीक है. एक कंटेंट हमें ये पता चला और एक कंटेंट. That is why I'm telling you, when you will be done with all the cranial nerves, I will make sure that you don't have to memorize anything directly. ठीक है. निमोनिक से एक साथ आंसर लिखना तेज हो जाएगा, but you will have a concept कि चल ठीक है यार, इस फोरामेन से ये जा रहा है तो उसकी कुछ लॉजिक है. ओके. Now after the jugular foramen, like I said, they separate again. The cranial root, it joins the vagus superior to its inferior ganglion. क्या मतलब हुआ इसका? There is a, okay, ये लाइव स्ट्रीम चल रही है क्या? Yeah, it got disconnected for me in between, so I got a little confused. Sorry for that. So yeah, so if there's a superior ganglion here and there is an inferior ganglion here, so the accessory nerve will join it somewhere here. And then after it joins, it will supply the muscles of the pharynx and the palate. I already told you which muscles of the pharynx are not supplied by the vagoaccessory complex. So can you tell me which muscle of the pharynx is not supplied by the vagoaccessory complex? Question for you, which muscle of the pharynx is not supplied by the vagoaccessory complex? Answer quickly, or tell me, just simply tell me which nerve supplies that specific muscle which is not supplied here. Simple answer, muscle of the pharynx that is not supplied. Yes, stylopharyngeus, Mishti, bang on correct. Not cricopharyngeus. This okay, cricopharyngeus कोई मसल होती है क्या? Cricopharyngeus तो as far as I know कोई मसल ही नहीं होती है, but कोई बात नहीं. Stylopharyngeus is the muscle that is supplied by the glossopharyngeal nerve, right? Stylopharyngeus नहीं supply होती, बाकी सब. That is one another very important statement. All muscles of the pharynx are supplied by the vagoaccessory complex except the stylopharyngeus. There's also another muscle called as the tensor ani and tensor villi palatini. Okay, they are also present in this region and they are supplied by the mandibular division of the trigemina. Then you will have a spinal root. Now spinal root का question भी बहुत common है. ठीक है. So the spinal root, it supplies the sternocleidomastoid and the trapezium. It supplies two muscles. Spinal root will supply two muscles, the sternocleidomastoid and trapezium. ठीक है. अभी मैं एक question पूछने वाला हूँ, वो बताना उसका आंसर. It will supply sternocleidomastoid and it will supply trapezium. बहुत इंपॉर्टेंट है ये मसल्स याद रखना. एंड दे ऑल्सो हैव proprioceptive fibers. वो भी याद रखने पड़ते हैं. C2 C3 और C3 C4 has a connection with C2. Okay, so the spinal root of accessory, it can have a connection with C2, or it can have a connection with C3, or it can have a connection with both of C2 C3. And if it does have that connection, that is known as ANSA of Mowbray. ठीक है, important नहीं है. एग्जाम पॉइंट ऑफ व्यू से पीजी एंट्रेंस में अभी नेक्स्ट में तो नहीं पूछेंगे, अभी पता नहीं, मेरे को आइडिया नहीं. ओ अच्छा, इंफीरियर कॉन्स्ट्रिक्टर मसल, वो तो नीचे वाला हो गया. राइट राइट. आई वाज टॉकिंग इन द रीजन ऑफ द nasopharynx and the oropharynx. Right. उनकी भी कुछ स्पेशल बात होती है ना, थायरोफैरिंक्स, pharyngeus and cricopharyngeus. Something special about them. Yes, I just studied my first year. So yeah, what was I telling you? So if this is your face, ज़्यादा accurate नहीं बनेगा. This is your sternocleidomastoid muscle on both sides, right? And on the back you have the trapezius muscle going. These are the trapezius fibers. So I hope you get my concept that I'm bringing to you to the posterior triangle. I'm bringing you to the posterior triangle. ठीक है? This is the ठीक है, cricopharyngeus by the recurrent laryngeum, right? एंड क्रीकोफेरेंजियस और थायरोफेरेंजियस के बीच में एक डाइसेंस बनता है जिसे कहते हैं किलियंस डाइसेंस, जिसके अंदर एक डायवर्टिकुलम होता है जिसे कहते हैं ज़ेंकर्स डायवर्टिकुलम. ओके, so this is the sternocleidomastoid and this is the trapezius, and the spinal root of accessory, it is a content of the posterior triangle, so it will be running between these two. Okay, first it will supply the sternocleidomastoid and then it will supply the trapezius. Now my question to you is, if there is an injury to the, it can be asked in your next examination as well, if there is an injury to the spinal root of accessory in the posterior triangle, what actions, what muscles will be affected? All right, so if I have to make it more complex, I will ask you actions, what actions will be affected. But if I have to make it a little simple, I will ask you which muscles will be affected. Okay, so you have to tell me the muscle which will be affected by an injury to the spinal root of accessory in the posterior triangle. After this, we just have the hypoglossal nerve left. After that, we will do the foramina. After that, we will do optic nerve lesions. Yes, Deeptanu, you're right. My PG preparation does get a little easy. And that also kind of helps you because I am pretty fresh with all my first year concepts, है ना? तो first year में कुछ टेढ़ी चीजें बताते हैं, and probably that is why I am able to relate a little more to the whole first year syllabus. Although I do admit that it is difficult for me to correlate it clinically to the pathology and the medicine portions, but that's why I'm not stepping there. I'm doing this from a more prof and core anatomy perspective. So if you're interested, you can watch these sessions and they're a good overview. Right. Mishti, you are wrong. Because see, the sternocleidomastoid, it will not be affected. Now, why am I saying the sternocleidomastoid will not be affected? Because this nerve is passing in the posterior triangle. So it's passing here, right? So the sternocleidomastoid, it has already supplied. So the lesion is here. So what is distal to this lesion? That is the part that will get affected. So the trapezius will get affected, and Akash already told you that it will, the shrugging of the shoulder is an action of the trapezius, the retraction of the scapula, all of this is something related to the trapezius. Winging of scapula, yes, to some extent, but winging of scapula is more or less related to your serratus, है ना? But trapezius में भी होता है. There's a slight winging of the scapula which gets more pronounced when it is for a longer duration. Right. So trapezius will get affected, whereas sternocleidomastoid muscle remain intact. But what if the spinal nucleus of accessory is injured? What if the spinal nucleus of accessory nerve is injured? In that case, you will lose the sternocleidomastoid sensation and you will lose the trapezius sensation. In that case, both sensations will be gone. Yes, long thoracic nerve. Right. So we're here. So I already told you the cranial part of accessory supplies all the palatal muscles except. How to adjust the mental disbalance, right? Nice, good question. So how to adjust the mental disbalance while shifting from NCRT to this bulky MBBS books? So one thing that was pretty helpful to me was that I study a lot of content that is marked, all right. So I don't usually, unless I'm teaching you right now, so I've studied everything. But otherwise, when I study for my first prof, I tend to read only those points which are marked first thing. Okay, so that reduces the bulk a little. Second, I see a lot of visuals. Okay, so I prefer, so for neuroanatomy there are Najib video lectures. Okay, I watch those. Then for your physiology you will have some osmosis videos. You get all of these videos and you can watch those. Then for your biochemistry, Harper is a decent book, and there's another book, Lippincott, so it also has a good presentation. So reading selective contents from selective places and reading what is required is one thing that is here. The second thing is that uh, you have to kind of admit or admit to yourself that whatever you read, you will have to read, because the syllabus of MBBS is definitely more bulkier than the 11th and 12th. So obviously the books become more bulky, but also then you have the entire year just to study that book, right? You don't have to worry about physics, you don't have to worry about chemistry. So that way things get okay, and I have this thing in my head that by the time I reach final year, I will be able to integrate everything, synthesize everything. So these things will keep getting repeated. Yeah. So cranial part accessory supplies the tensors. ये हट जाएगा, ठीक है. याद रखना tensors are supplied by the mandibular division. Tensors are supplied. Now question number two: muscles which are spared by the complete transaction of the cranial part of accessory. Muscles that are spared by the complete transaction of the cranial part of accessory. Thank you, Akash. So, style of ranges gets spared here because it is supplied by the gloss of range. Very easy. Question number three: choose the incorrect statement concerning the pharyngeal plexus. Incorrect statement. These are kind of, all these questions are to reinforce your concepts, to help you understand what parts are important, what things have to be memorized in what way. So I have a few MCQs, तो अभी थोड़ा MCQ round चलेगा मस्त. So keep answering. I am reading your chat box. Just write the question number and just write the answer. Absolutely correct, Akash. Tensor tympani. So, like I told you, the tensors are going to be supplied by the. Let's move to question hypoglossal nerve before we go to the further questions. The hypoglossal nerve, it arises from the medulla. So, it arises between the pyramids and the olives, है ना? अभी हमने जो diagram बनाया था, right? Mishti is also right. This is your midbrain, this is your pons, and this is your medulla oblongata, right? So here you had the central, this is your region, and this is your pyramids. These are your. So let's say these are your pyramids, your pyramid, and this is your olive. You have around 15 to 20 rootlets from which the hypoglossal nerve arises. They come from here, and then goes. That is the hypoglossal nerve or the 12th cranial nerve. That's how it takes its origin. So it is basically coming at the level of the medulla between the pyramids and the olives. Okay? So I hope that much is clear. So it is in the sulcus between these two. Then talking about the hypoglossal canal, then it moves to the. So like I told you that यहाँ पे on the base of the skull around the foramen magnum you have two uh, kind of foramens for the hypoglossal canal, from where you will have the passage of the hypoglossal. Will come out from here, right, on the sides of foramen magnum. ठीक है, तो वहां से वो बाहर निकले, that is known as the hypoglossal canal, and then it runs between the internal carotid artery and the internal jugular vein. That is similar to the 9th, 10th, and 11th. When it exits through the hypoglossal canal, it gives a meningeal branch, which is again going to supply the meninges, the dura around the hypoglossal canal. Then it goes deep to a muscle that is your posterior belly of digastric. ठीक है, अब का diagram I should hopefully have kept. Oh, I have not kept a diagram. Okay, anyway, I'll send it on my Telegram channel, that is at the rate NEET PG Chetanya. I also had a UG channel, that's why it's called NEET PG Chetanya. So then after it goes from here deep to the posterior belly of digastric, it gives a division downwards which is known as the descendants hypoglossae, okay, which is the superior root. Akash, I will definitely share all these notes, you don't have to worry about taking notes, okay. So this is known as the descendants hypoglossae, which is the superior root of the ansa cervicalis. I will talk to you right now about what is the ansa cervicalis, and there are some fibers from the C1 which come along with it and they piggyback on it. Okay, now what is piggyback? Or so basically they're just carried by the hypoglossal nerve. They do not intertwine, they do not mix, they stay separate, but they use the hypoglossal nerve to go to their structures of origin. So it passes forward, it moves. So if this is the common carotid artery here at the level of C3, C4, so it will move laterally to the common carotid artery and it will go outside laterally, superficially to the surface of hypoglossus. And the C1 fibers that were piggybacking with it, they will supply the thyrohyoid and the geniohyoid, not the hypoglossal nerve, but the C1 fibers via the hypoglossal nerve. So it supplies all muscles of the tongue except the palatoglossus. Can you tell me which nerve will supply the palatoglossus? Which nerve will supply the palato? All muscles of the tongue. So there are two kinds of muscles of the tongue: extrinsic muscles and intrinsic muscles. Intrinsic muscles have their origin and insertion inside the tongue itself. Extrinsic muscles are coming from a outside structure. For example, you have your thyrohyoid. You so that is an extrinsic muscle. Sorry, um, not thyrohyoid, obviously. All these muscles usually have glossus in them, right? So you have genioglossus, you have So you have a muscle known as styloglossus, right? So it comes from the styloid process. It enters the tongue. So that is an extrinsic muscle. So yeah, if people have given an answer, it's not cranial nerve 9. Cranial nerve 9 only supplies stylopharyngeus. It does not supply palatoglossus. Palatoglossus is supplied by the vagoaccessory complex because it is also a muscle of the palate, and palate pharynx larynx in general is supplied by the vagoaccessory complex, not the glossopharyngeal. Glossopharyngeal only supplies one muscle, stylopharyngeus. Deep Tanu, yes, रैगिंग सिस्टम अभी यहाँ पे ओपन में डिस्क्लोज नहीं कर सकते एम्स दिल्ली का क्या है. So people who get selected, they are the people who get to know about it. But let me assure you that there is no physical ragging and there is no ragging that is bad in any way. Okay, so there's no physical ragging, there is no sexual harassment, so to speak. The palsy of the right genioglossus causes. What does the palsy of the right genioglossus cause? So I am sure you are not aware of the action of the genioglossus, or even if you are, you can still answer it otherwise. But you will need to know a little bit about how genioglossus acts to answer this. So let's see if you are able to answer this. Otherwise, obviously, I'll tell you. This is question number 1 from hypoglossal. Palsy of the right genioglossus. This question can also be framed as palsy of the right hypoglossal nerve, right? The right hypoglossal. Does it cause deviation of the tongue to the right, or deviation of tongue to the left, deviation of the soft palate to the right, deviation of the tongue to the right? Okay, Akash has given an answer. That's correct, Akash. Now, why does that happen? So think of it in this way. If this is your tongue, the genioglossus is kind of a lifesaver muscle. So it has the role to keep your tongue like this. So this side genioglossus exerts a force here, and the genioglossus of the other side will exert a force in the opposite direction. Okay, so this is the left side and this is the right side. So if let's say the right genioglossus gets injured, if this one gets injured, so these fibers they won't be working. These blue fibers they will not be working. So the left side genioglossus will push it towards the right side, and this is a very specific case where the genioglossus can, where the lesion has, otherwise what happens usually when there is a muscular defect, so the fibers of the opposite side pull it towards itself and the deviation is towards the normal side. What is special here about the hypoglossus is that the deviation is towards the normal side, towards the abnormal side. So the deviation is towards the side of the lesion. This is called as deviation is ipsilateral towards the lesion. Ipsilateral deviation. Okay. Question number 2. Incomplete unilateral damage to the hypoglossal nerve. All are true except asked in the AIMS 2012 exam. I hope you understand why it deviates on the same side for the tongue and why it will deviate to the opposite side for the pharynx. The famous AIMS Delhi question was the Shimla trip sponsored by AIMS. No. AIMS used to sponsor a Shimla trip. In fact, there used to be a Manali trip, there used to be a Mount Abu trip, but those days are gone. The AIMS Student Union used to do that. Now we have to pay for our own simulator, so we paid 4,500 rupees for that. So except, right, so there is no loss of tactile sensation. Why? First tell me which fibers, which nerve carries these tactile sensations from the tongue. Okay, this is answer is correct. Yes, cranial nerve 12 is motor, absolutely. Bang on correct. 12 is motor, so it will not have any effect on the tactile sensations. Tongue atrophy हो जाती है, defected side की deviation हो जाती है. Larynx deviate करता है contralateral side during swallowing में. ठीक है, but D loss of tactile sensation नहीं होगा. Tactile sensation is related to, it is different for the posterior one third of the tongue. It is through the glossopharyngeal. You have to tell me what about the anterior. Give you a hint. The thickest nerve. Okay, so now let's move to this. What is this now? The ansa cervicalis. This is the ansa. Now, why I am taking this up here is because it is related to the hypoglossal nerve. The cranial nerve number 12, as you can see here, cranial nerve number 12 is going here. The C1, the fibers from cranial nerve number 1, they will join the hypoglossal nerve. They will join the hypoglossal nerve, and this is the piggyback I was talking to you about, right? They piggyback along with the nerve, right? So they move along with, yeah. So here, what all will they supply? They will, so there goes a root downwards. This is known as descendants hypoglossi. This is known as descendants. Kuldeep Gadhavi has given the right answer. Very good. Descendants hypoglossi, right? Descendants hypoglossi will go down. They will curve around in this loop, which is known as ansa. So ansa is a loop, and cervicalis is because it is related to the cervical. There is also ansa subclavia, which is a loop around the subclavian artery. This is the ansa cervicalis. It will go down. It has a superior root and there is an inferior root coming from C to C3. Why this is superior? Because this is coming from C1. Why this is inferior? Because it is coming from C2, C3. So this will form a bend here. Hello. Okay. Hello, Karnati. Right. This is your ansa cervicalis. And the superior root is contributed by C1, inferior root is contributed by C2. Now, what are the other muscles that C1 supplies? Remember, I told you that the C1, it piggybacks along with the hypoglossal nerve and it will supply the geniohyoid and the thyrohyoid muscles. They are not supplied by the hypoglossal nerve, they are supplied by the C1, which only uses, इस्तेमाल कर लेती है वो hypoglossal nerve का कि भैया तू जा रही है तो मैं भी साथ चलती हूँ. It supplies the geniohyoid and the thyrohyoid. ठीक है? Then it goes to the genial tubercle here and it supplies the. Okay. And then what are the muscles that are supplied by the ansa cervicalis as well? So it is essentially supplying the sternohyoid, the omohyoid, then it supplies the sternothyroid and these muscles with the. So now, okay, if you can answer this question, you can. What is the answer to this question? Are they supplied by ansa cervicalis? Yes. Thyrohyoid. Why? Because thyroid is supplied by C1, which is piggybacking with the hypoglossal nerve, right? These three muscles, they will be supplied by the ansa cervicalis. Now these are all the strap muscles here. These are all called strap muscles because they will form this region. They're present in this triangles here. So thyroid. Yes, Kuldeep Gadhavi is right. The answer is thyrohyoid. Why? Because thyrohyoid and geniohyoid, they are not supplied by this loop of the ansa cervicalis. They are instead supplied by C1, which is piggybacking with the hypoglossal nerve. The answer here is, so right now it's time to move to the foramina of the skull. It's time to move to the foramina of the. Should we start with the foramen of the skull? So we'll build a very basic concept here also, and we'll talk about all the things that we have talked about in cranial nerves number 1 to 13. 13 की बात तो यहाँ नहीं करेंगे, obviously 1 to 12. Should we start with the foramina here? Are you able to see what is written on the slide? I'm not sure if it is as clear to you. How about now? Could you tell me if it's clear so that I continue? Okay. Anyways, I can see it's clear. So if I move here, on top here, so I'll take the skull as well to explain it to you a little better. On the top here, you have something here called the crista galli. All right, it's a fold of bone here. You can see this triangle that is pointed. Okay. So on the side of it, you have this small foramen, which may or may not be present, which is known as the foramen cecum. Okay. Now there is another foramen cecum. In fact, so this foramen cecum, it first of all may not always be present. Okay, and when it is present, it gives an emissary vein to the superior sagittal sinus, which connects it to the nose. All right, this I would have covered if you would have covered the nose so far, but you can leave this. This is not important. Second, you have some foramina on the sides here. Those are the anterior and posterior ethmoidal nerves, where you will have the anterior ethmoidal artery, anterior ethmoidal nerve, and the anterior ethmoidal vein accompanying it. Then you have this perforated plate, although it's a little destroyed in my skull. This is known as the foramina of the cribriform plate, where you'll have all the olfactory nerves emerging. Right? After that, if I move behind, you have what are known as the posterior ethmoidal foramen. ठीक है? Where you will have the posterior ethmoidal artery, nerve, and vein emerging. उसके बाद, let's come to the important thing. On the inside here, I hope you can make out the superior orbital fissure. In this, you will have the superior orbital fissure here, and this is the optic canal, right? You can see the optic canal. So this is the superior orbital fissure, and here you have the, I hope my pen is coming out. Yeah. So the superior orbital fissure gives you a lot of structures. Remember, we discussed the tendinous ring yesterday. We discussed the tendinous ring. So what is all was going inside the tendinous ring? We are going to talk about that. So thank you, Kuldeep. Glad it's clear. So there was a optic canal that was present inside the tendinous ring. There were some structures that were going through the superior orbital fissure, and there were very minor structures that were going through the inferior orbital fissure. So to give you a recap, let me draw this diagram. This is the common tendinous ring. So what are the structures that were present outside the ring but going through the superior orbital fissure? So I had told you a mnemonic for this. The mnemonic was LFT, right? You will have the L, F and T here. That is the lacrimal branch. F is for frontal branch, T is for trochlear branch, right? And you had some other structures outside also. Here inside, what all did you have? You had the superior and inferior divisions of oculomotor. In between those were present the nasociliary branch, right? And outside here you had the abducens nerve. What was present here? You had the optic nerve and the ophthalmic artery. These were all the structures that were present in the tendinous ring. These were all the structures that were present in the tendinous ring. Now let's come back here. So you can see in the optic canal, they have written optic nerve and ophthalmic artery. So what all have we covered first of all? Let's just keep taking it along with us. So foramen cecum may or may not be present. Anterior ethmoidal foramen, posterior ethmoidal foramen and claviform plate. Optic canal is done, optic nerve and ophthalmic artery. Superior orbital fissure, from inside the tendinous ring you have the oculomotor nerve and the nasociliary branches. Outside you have LFT. Inside you also have the abducens nerve. Now in the superior orbital fissure outside the tendinous ring you will also have the superior ophthalmic vein going along with it. Now we come to three important foramina which are related to the trigeminal in some way. So here you have a round foramen. I don't think you will be able to appreciate it. So this round foramen shown here, which is present inside the temporal bone, that is known as the foramen rotundum. Alright. So foramen rotundum is allows the maxillary nerve to pass through it. Okay. So what happens? This is the trigeminal ganglion. The ophthalmic division goes forward into the superior orbital fissure. Here you have the rotundum, the maxillary goes here and the mandibular comes down through the foramen ovale. So the mandibular nerve here is the content of foramen ovale. The content of foramen rotundum is maxillary nerve. Then mandibular nerve also has some other structures going with it. That is the accessory meningeal artery and the lesser petrosal nerve occasionally. Okay. So this is the foramen ovale. I hope you can appreciate this structure here that is oval in shape. Okay. There is an oval structure here that is known as the foramen ovale. Right. So the foramen ovale, you can also make it out here that it is an oval structure. And from here you will have the mandibular nerve, the accessory meningeal artery and the lesser petrosal nerve. Right. And then behind it you have another small foramen known as the foramen spinosum, which is having the middle meningeal artery and vein and the meningeal branch of mandibular nerve going through it. Now we have a mnemonic to help you memorize foramen ovale and foramen spinosum. Okay, so let's do that mnemonic. So foramen, okay, let's shift to white. Foramen ovale. The mnemonic here is male, and for foramen spinosum is men. Okay. Now if I replace this M, I can also write it as OVALE. Okay. So this is the mnemonic I am going to use because this is a little better. How is this related? The foramen ovale has the mandibular division of trigeminal, or you can write it as V3. ठीक है, तो V भी हो गया, M भी हो गया. A सेम है, यहाँ पे कौन सी? Accessory meningeal artery. L is the lesser petrosal nerve, which passes occasionally through it most of the times. Then always remember, whenever you don't know anything, E always stands for emissary vein, the head and neck, because there are a lot of emissary veins going and they mostly pass through all these foramina. So E here is also emissary vein and here also E is emissary vein. Now what is this M? M is middle meningeal artery and middle meningeal vein, and this is the foramen spinosum, so it will have the nervous spinosum passing through it. This is a branch from the mandibular nerve. It is a recurrent branch from the mandibular nerve. And what is this O? O is the otic ganglion. This is to help you remember that the otic ganglion is related to the mandibular nerve at the foramen ovale. So this is the mnemonic I like, ovale men. Alright, so you write male men, male will remind you of ovale, then you write men. Or you write ovale, ovale should remind you of male, male should remind you of men. Ovale, male, men. Ovale, male, men. Okay, so that is how you remember. And then it is very simple. Mandibular nerve related to the otic ganglion, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. Men is middle meningeal artery and middle meningeal vein. E is emissary vein and N is nervous aneurysm. So this is done. Rotundum, ovale, and spinosum is done. Then foramen lacerum does not have any contents because it is filled with cartilage. So there is no structure going inside it. But the internal carotid artery and the greater petrosal vein, they pass above it. ठीक है, उसके ऊपर से निकलते हैं. You can appreciate the foramen lacerum here. It's called lacerium because it has an irregular appearance, which is kind of a lacerated appearance. ठीक है, तो foramen lacerum से nothing passes, but the internal carotid artery and the greater petrosal vein are related to it. Then you have the carotid canal. Obviously, what will pass through it? The internal carotid artery and the carotid plexus around the internal carotid artery. Very obvious. Carotid canal is not an issue. Okay. Then you have a small hiatus for the lesser petrosal nerve laterally, and more medially you will have the hiatus for the greater petrosal nerve. Lesser petrosal nerve will pass forward and exit through the foramen ovale. Greater petrosal nerve will pass forward and go through the foramen lacerum, and then it will move outside. Okay. Then internal acoustic meatus, already told you the contents. Labyrinthine artery, facial nerve and vestibulocochlear nerve. I had already asked this in the start. Then you will have the jugular foramen. So jugular foramen is a little interesting. Kind of a very big space for a foramen. So there are three parts to the jugular foramen. Okay. This is the anterior portion. This is the posterior portion. This is the middle portion. So here anteriorly you will have veins. You will have the venous system. What is the vein here? The vein here is known as the inferior petrosal sinus, which is the first tributary of the internal jugular vein, which is formed in the jugular foramen. Okay. What will you have posteriorly? Posteriorly, you have an artery known as the posterior meningeal artery. Posteriorly, you will have an artery known as the posterior meningeal artery. And through the middle part, what will pass? Three nerves, 9th, 10th, 11th. Okay, so that's how you have to remember the jugular foramen. Jugular foramen is done. Hypoglossal canal, I already told you on the side. This is present on the side of the foramen magnum. Hypoglossal canal and contents of the foramen magnum, guys. देखो contents of the foramen magnum थोड़े से important है because it is the largest foramen present here. तो उसके contents नहीं याद होंगे तो किसके याद होंगे, है ना? See, foramen magnum has the, obviously it will have the brainstem passing through it, entering into the cranial fossa. So it will have the medulla oblongata present inside. Besides that, since it is a part of the brain, you will have central nervous system. You will have meninges present around it. ठीक है? So obvious medulla oblongata and meninges. उसके अलावा, you should know that the fourth part of vertebral artery begins after the foramen magnum. So the vertebral artery, which is coming from the foramen transverse areum, then it moves in the suboccipital triangle. ठीक है, छोड़ो वो सब. But it moves in the foramen magnum and it becomes the fourth part of the vertebral artery. Okay. Then since the vertebral artery is coming, it gives a few branches to supply the meninges. So you will have the nerve supply of the meninges and you will have the arterial supply of the meninges. Besides that, I told you that C1 to C5, they form the spinal nucleus of accessory. So they will be giving a root that will enter here, that is the spinal root of accessory nerve. So I hope your major foramina, they get covered from this explanation. So we are done with anterior ethmoidal, cribriform, posterior ethmoidal, optic canal, superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum, foramen lacerum, carotid canal, hiatus for lesser petrosal nerve, hiatus for greater petrosal nerve, internal acoustic meatus, ocular foramen, hypoglossal canal, and the foramen. Right? Now we are going to talk about the foramen present on the norma basalis of the skull. So norma basalis is this view that you get from the base of the skull. So what you can appreciate here, you can appreciate a foramen here. This is known as the, so these are the incisor, these should have been the incisor teeth in front. And here you have a fossa. So that is known as the incisive fossa, where you have the sphenopalatine vessels and the nasopalatine nerve. So nasopalatine nerve, naso is first and then you have palatine. So it is coming from the nose going to the palate. Sphenopalatine ka ulta hai, it comes from below and it enters the nose. So incisive fossa is done. Then you move behind. Here you have a greater palatine foramen, and behind that here you have the lesser palatine foramen. So the greater palatine nerve and vessels and the lesser palatine nerves and vessels will pass through it. Okay. Then we come to foramen ovale, again visible here. So foramen ovale is same as this. जो अंदर जाएगा वही तो बाहर आएगा. So lesser petrosal nerve, mandibular nerve, and accessory meningeal, foramen spinosum, middle meningeal vessels, and meningeal branch. Alright. Then carotid canal, internal carotid artery and its plexus. Then what we have missed is the petrotympanic fissure between the petrous part and the temporal part of the temporal bone. Okay. So that is known as the petrotympanic fissure. So chordae tympani branch of the facial nerve is coming outside. Then there is a tympanic calculus for canaliculus for the tympanic branch of glossopharyngeal nerve to come inside. You have the foramen here for the mastoid canaliculus. You have a canal here called the mastoid canaliculus, which is for the auricular branch of the vagus nerve. So the auricular branches of the 9th, 10th, and 7th, 9th, and 10th are related here. The chordae tympani, the tympanic branch, and the auricular branch. One is through the petrotympanic fissure, one is through the tympanic calculus, and one is through the mastoid canaliculus. Then behind that, you know that this is the styloid, this is the mastoid process. This prominence is the mastoid process, and here you have the styloid process. Between them, you have a foramen which is known as the stylomastoid foramen, through which the facial nerve exits. And here, this site is very common for facial nerve injury, especially if the mastoid process gets injured. Facial nerve injury here is a common occurrence where you will have paralysis of your muscles of facial expression. Stylomastoid foramen. Then jugular fossa we already talked about. You will have the glossopharyngeal nerve, vagus nerve, accessory nerve, internal jugular vein. So now the inferior petrosal sinus has become the now part of the internal jugular vein. So internal jugular vein will be here. Inside the jugular foramen, this internal jugular vein is known as the sigmoid sinus. Then it gives a, then you have a superior bulb. Okay, and this superior bulb के बाद it forms the internal jugular vein. So it is present in this big fossa here known as the jugular fossa. So it's a very large fossa if you actually see it on the skull, and you will have all this emerging from there. Okay, I hope you are able to understand this story that is there. What happens here? So this is, let's say, your jugular foramen, and this is your jugular. So here you have what is known as the sphenoidal sinus, which is an S-shaped sinus. Terminally, it has a dilatation known as the superior bulb. It has the superior bulb, and this is the sigmoidal. As it is moving out, it becomes the internal jugular vein, which gives a tributary which is known as the inferior petrosal sinus. Okay, so Amazonians get around 0 leaves for Diwali. So we do not get leaves for Diwali. That is a misconception. So this is done. Now mastoid foramen not important, but mastoid ठीक है. Emissary vein होती है इसमें से, जहाँ पे ना समझ आए emissary vein होती है. नीचे hypoglossal canal दिखेगा, उससे hypoglossal nerve, foramen magnum. So obviously you will see medulla oblongata, vertebral artery, and venous plexus, and the roots of. So we are done with the entire foramina. देखो कितने सारे हैं ये, and we have covered it in, I guess, 10 से 15 मिनट में कवर कर दिया हमने ये सारा। ठीक है, तो बहुत इंपॉर्टेंट है, दीज आर डेफिनेटली गोइंग टू बी आस्क्ड इन योर वाइवा। एंड लेट्स मूव फॉरवर्ड टू अ क्वेश्चन। आंसर टू दिस, not pass to the marked foramen. Question number one of the foramina. So we are going to have a few MCQs now. Question number one: which of the following structures do not pass through the marked foramen? Okay. You can skip through this portion if you are watching this later, and you can just answer them yourself. Any answers, doctors? Mishti is right in saying that the answer to this question is maxillary nerve. So remember, this looks like an oval, so this is obviously foramen ovale. Now, what else is shown to you in this diagram? So, what is this bone that is shown to you? This is the sphenoid bone. Oh, I guess I might have said temporal when I was talking about this. This is the sphenoid bone, right? You have the foramen ovale present in the sphenoid bone here. Then posteriorly, you will have the foramen rotundum. This is the, not posteriorly, anteriorly and a little superiorly, you will have the foramen rotundum through which maxillary nerve passes. Right? Maxillary nerve is the content of foramen rotundum. Foramen ovale is ovale itself, right? So it is mandibular division of trigeminal, otic ganglion, accessory meningeal, lesser petrosal, and hemispheric. Teacher, this is the foramen spinosum. Contents are MEN, men, middle meningeal artery, hemispheric vein, and nervous. Question number two. Which of the following cranial nerves are present in the posterior fossa? Question from AIMS 2006. So do you guys want me to do a head and neck MCQ marathon which will completely prepare you for all your vivas? We'll do 150 questions. We'll do 150 questions. Do all of them quickly. Any answers, doctors, for this question? Mishti is again the fastest answer, but that answer is kind of wrong. Okay, so I'll explain it to you anyway. So nerves present in the posterior cranial fossa. These are the 3rd to 12th. Why? Because these are the ones which arise from your brain stem. So remember your optic nerve and your olfactory nerve, they are coming from front, from the anterior part. But all of these are related to your brain stem. All of these are related to your brain stem. Right? So since they are related to your brainstem, they all arise in the posterior cranial fossa and are present there because your brainstem is in the posterior cranial fossa. I hope you understand this division. This is the anterior cranial fossa. This region formed by the wings of the sphenoid and the temporal is the middle cranial fossa, and this deep part is the posterior cranial. Question number 3. Dura matter is supplied by all cranial nerves except. This question from AIMS 2000. Very simple question. Even a NEET UG aspirant, if he thinks enough about it, he can answer this. Alright. So just think a little about this. I know you can answer this. No, Vatsal Srivastu, you are wrong. Third does not come out dorsally. Third comes out ventrally. Trochlear nerve is the only cranial nerve. Trochlear nerve is the only cranial nerve which exits the brainstem dorsally. Right? The oculomotor nerve, it also exits on the ventral side in the interpeduncular fossa. You can see my yesterday's lecture. I covered the oculomotor, the trochlear, and the abducens nerve in detail. Okay. No, 12th is the wrong answer. Vatsal Srivastav. See, hypoglossal canal. Remember, I told you hypoglossal canal may the hypoglossal nerve gives a meningeal branch. It gives a meningeal branch. Okay, so it is not 12th. Yes, Mishti is right. It is trochlear. So trochlear, it does not supply the dura mater. Okay, and that is why the answer is trochlear. ठीक है, I guess नीट यूजी वाला बच्चा नहीं सॉल्व कर सकता होगा. थोड़ा सा एक्स्ट्रा नॉलेज चाहिए थी हाइपोग्लॉसिक कैनाल वाली. बट यू कैन सिंपली एक्सक्लूड फोर्थ. अच्छा ठीक है, छोड़ो, मतलब उसमें नहीं जाता है. Okay, Vatsal, great. You should just go to head and neck part 2. That is where I've explained cranial nerves 1 to 7. I've explained all the columns of the cranial nerves. You will not have to remember anything. It's all a very conceptual thing. So try and watch it. Next is all structures pass through the foramen ovale. ये तो हमारे mnemonic से क्वेश्चन आ गया ना सीधा सीधा. Question number 4. The mnemonic I hope you know for foramen ovale and उसके बेस पे इसको फटाफट से आंसर कर दो. Yes, this is absolutely useful for your profs. This is fact you should tell your friends कि prof की पढ़ाई यहाँ से कर लो यार, बुक से पढ़ने की जरूरत नहीं. राइट, एब्सोल्युटली. आंसर इज मिडल मेनिंजियल आर्टरी. क्योंकि मैं बेसिकली बीडीसी विश्राम सिंह वाले कंटेंट से अपना कंटेंट बना रहा हूँ. ग्रेस, बीडीसी विश्राम सिंह एंड थोड़ा बहुत पीजी एंट्रेंस. आंसर इज बी, where you will have your MEN, which is your middle meningeal artery, emissary vein, and the nervous spinosum. So these are contents of foramen spinosum. So they will not pass through the foramen ovale. They will not pass through foramen ovale. Answer is middle meningeal artery. Ovale का mnemonic क्या है? Ovale का mnemonic ही ovale है. ठीक है, याद रखना. Ovale का mnemonic ovale. या फिर अगर ओ नहीं याद रखना तो मेल याद रख लो. इसमें ओ क्या होता है? इट इज रिलेटेड टू द ओटिक गैंग्लियन. द मैंडिबुलर डिविजन इज रिलेटेड टू द ओटिक गैंग्लियन. ओवेल का निमोनिक ओवेल होना थोड़ा आसान है याद रखने को. दैट्स इज व्हाई आई से दैट ओवेल याद रख लो. एंड उसमें यू आर एबल टू रिमेंबर वन एक्स्ट्रा फैक्ट आल्सो. तो दिस इज माय प्लस रेफरल कोड गाइस. अगर किसी को भी प्लस सब्सक्रिप्शन लेनी है, किसी भाई बहन को लेनी हो यूपीएससी वगैरह की, तो भी इस कोड से दिलवा देना. टॉक टू मी, आई विल मेक श्योर दैट यू गेट सम एक्स्ट्रा पर्क्स. स्ट्रक्चर्स पासिंग थ्रू द टेंडिनस रिंग ऑफ जिन. ठीक है, ये टेंडिनस रिंग ऑफ जिन क्या है भाई? कुछ नहीं है, कॉम्प्लिकेशन है. कॉमन टेंडिनस रिंग की बात ही हो रही है. Okay, so you are saying structures passing में मिष्टी, आकाश and अश्विन प्रभु. All three of you are saying nasociliary nerve. तो बस मैं आपकी बात कैसे मना कर दूं? Nasociliary nerve is the right answer. Mnemonic for structures which are outside in sequence is LFT. Ashwini is wrong. It's not A. Superior ophthalmic vein is outside the common tendinous ring. याद है ये डायग्राम से बनाया था ये कभी? यहाँ बाहर क्या होता है? LFT प्लस सुपीरियर ऑप्थेल्मिक वेन. इधर क्या जाती है? दो डिविजन ऑक्यूलोमोटर की, उसके बीच में प्रेजेंट होती है नेजोसिलरी. सो सुपीरियर डिवीजन ऑफ ऑक्यूलोमोटर, नेजोसिलरी एंड इंफीरियर डिवीजन ऑफ ऑक्यूलोमोटर. अच्छे से बनाऊं क्या ये डायग्राम, अगर किसी को नहीं पता? ये लायन फिश ने भी सही आंसर दे दिया. सी शाबाश लायन. दिस इज योर सुपीरियर ऑर्बिटल फिशर. दिस इज योर इंफीरियर ऑर्बिटल फिशर. Your tendinous ring. Here you will draw the optic canal, you will draw the optic nerve, and then inferolateral to it you will draw the ophthalmic artery, right? So this is the optic nerve, this is the ophthalmic artery. These are present inside the common tendinous ring, but outside the superior orbital fissure. Okay, Ashwini, I'll try to keep my language to English with just an occasional Hindi comment. Outside the mnemonic here is LFT, that is the lacrimal nerve. The F is for the frontal and T is for the trochlear. And you will have a vein here, that is the superior ophthalmic vein. Then there are a few miscellaneous structures. Inferior orbital fissure, you will only have one structure, that is the inferior ophthalmic vein, which may or may not be present, generally not present. Then you have the four structures here. See, this is the lateral surface. So this is the lateral rectus. What supplies the lateral rectus? The sixth nerve, the abducens nerve, right? And what are these three structures? These two big structures that you see, they are the inferior division of oculomotor, and this is the superior division of oculomotor. So what is left inside is the trochlear. Sorry, not trochlear, nasociliary. Nasociliary is the division of the ophthalmic, or the it is the division of the ophthalmic division of trigeminal, which passes from inside, right? Question number 6 पे चलते हैं. Mass in the jugular foramen. Mass in the jugular foramen may result in all except. Okay, very important to read all and except. Mass is in the jugular foramen. So let's say there is a cancer, the jugular foramen. Could be something else. Question number 6. Mass in the jugular foramen. What are the options? Cultine swallowing, hoarseness, Cultine turning the neck to the opposite side, and tongue deviates to the. What is your answer, doctors? का D. Okay. That is the answer Mishti has given. 6 का D. Let's see if she's correct or not. Or is it her fastest correct answer or is it the fastest wrong answer? Right? So the other people who are watching, if you have some answer in your mind, tell me. If you don't know, just write I don't know. The answer is the tongue deviates to the answer. Why? Because jugular foramen, remember it has the ninth, 10th, and the 11th nerve which pass through it. Okay. So the ninth nerve, yes, the tongue is supplied by the hypoglossal nerve, है ना? And the hypoglossal nerve it passes through which foramen? It passes through the foramen for its own. It has a hypoglossal canal. Okay, it passes through the hypoglossal canal. ठीक है, so it passes through the hypoglossal canal, so it is not the correct answer. So it is not going to happen if there is a mass in the jugular foramen. Why does C happen? So you're confused between C and D. So difficulty in turning the neck to the opposite side. Now this action is due to your this muscle which is the sternocleidomastoid, and sternocleidomastoid and trapezius was supplied by the spinal root of accessory. So this will get damaged. The sternocleidomastoid function will get damaged if you choose C. Okay, this is this will happen, and obviously hoarseness will be there because your laryngeal nerves will get damaged and you will have difficulty in swallowing because pharynx. So lesser petrosal nerve passes through. So this is question number. Lesser petrosal nerve is the content of. Right. So a lot of you have given 7 ka B. It is correct. Passes through the foramen ovale. Ovale mein L is lesser petrosal nerve. This is the foramen ovale. Question number 8. Incisive foramen transmits. So what all does the incisive foramen transmit? So I told you that there is a nerve and there is an artery here. Okay. Sorry, I think I lost internet connection in between. Question number 8. Incisive foramen transmits. No, C is wrong. It's not the sphenopalatine nerve. Alright. Sagarika is right. It is answer is D. The greater palatine artery and the nasopalatine nerve. Okay. So I told you that there is a nerve that goes from the nose to the palate. So that is the nasopalatine nerve, and there is an artery which will run here and it will go up the incisive fossa, which is known as the greater palatine artery. The answer here will be D. Okay. So question number 9. Structures which pass through the internal auditory meatus are all except. Now this is very easy for you to attempt. Question number 9. Which pass through the internal auditory meatus. Remember, I also told you a mnemonic here. 7 up, poke down. Are all except. See, the question says all except. So superior vestibular nerve, it is part of the vestibulocochlear nerve, so it does pass through it. So here you have the superior vestibular nerve and here you have the inferior vestibular nerve. So the answer is not C. The answer is B, absolutely correct. Anterior inferior cerebellar artery. Alright. So the nerve of Risberg is another name for nervus intermedius, right? Which is the sensory and the parasympathetic root of the facial nerve. The cochlear nerve also passes. So A, C, and D pass. The anterior inferior cerebellar artery, it does not pass. But there is a branch of the anterior inferior cerebellar artery. So Mishti only has given the right answer. It's not C, it's not A, it's not D. D. The anterior inferior cerebellar artery, although has a branch, it has a branch. What is the name of that branch that passes through the inferior auditory meatus? There is a branch of the anterior inferior cerebellar. Yes, nervus intermedius is the sensory and parasympathetic branch of the facial nerve. The separate motor root, and there is a nerve of this Risberg is basically another name for that. Okay, Alexa on over. Yes. So this is labyrinthine artery. Absolutely correct. Bang on, Akash. This is labyrinthine artery. So it is a branch of the anterior inferior cerebellar artery. It may also be a branch of the basilar artery, but more commonly anterior inferior cerebellar artery. This is also a question for your NEET. And it can also be asked in the blood supply of your brain. And you also have to remember, I told you at the start of yesterday's lecture that labyrinthine artery is a end artery. It is an end artery. Question number 10. Choose the incorrect pair regarding the skull foramina and the structures passing through. Choose the incorrect pair regarding the skull foramina and the structures passing through. Yes, it supplies the internal ear. Right. Labyrinthine artery, you must remember, supplies the internal ear. So, does the maxillary nerve pass through the foramen rotundum? Yes, it does. Does the vestibulocochlear nerve pass through the internal acoustic meatus? Yes, it does. The inferior petrosal sinus, is it in the anterior part of jugular foramen? Yes, it is. The inferior petrosal sinus is present in the front. Then you have the ninth, 10th, 11th here, and posteriorly will have the posterior meningeal artery. Will have the posterior meningeal. Foramen spinosum, middle meningeal artery, that's true. MEN structures. The superior orbital fissure does not have the optic nerve passing through it. Answer is E. Kuldeep is wrong, Sagarika is wrong, Mishti is wrong. Answer is E. Because the superior orbital fissure is this structure. Okay? So through it you have these nervous structures passing. That is the superior and inferior divisions of oculomotor, nasociliary, and abducens. The optic nerve, it passes through the optic canal itself, right? So optic nerve has its own canal through which you have the optic nerve and the ophthalmic artery, right? You understand why it is E here? Please write yes if you understood why the answer is E. Maxillary nerve, it passes through the foramen rotundum. Mandibular nerve passes through foramen ovale, which is behind it. ठीक है? ये राउंड, ये ओवल, यहाँ से maxillary V2, यहाँ से पीछे से V3, आगे superior orbital fissure से V1. Testiculocochlear, obviously in the internal ear में जाना तो internal acoustic meatus से जाना पड़ेगा. Jugular foramen का ये बता दिया. Inferior petrosal sinus is the anterior part, middle part is 9th, 10th, 11th, and more posteriorly posterior meningeal. Okay. And anterior part of jugular foramen हो गया. Foramen spinosum से main structures है middle meningeal. ठीक है. अब ये क्वेश्चन मैंने बेसिकली कल कराया था जब मैंने abducens nerve का पाथ बताया था. तो Dorello's canal, what does it transmit? What is, first of all, you should know what is the Dorello's canal. It is basically a folding of the dura mater, right? And it has a petroclinoid ligament. Petrous part of temporal bone and anterior clinoid process से related होता है. Petroclinoid ligament, उससे related एक structure होता है जिसे कहते हैं, what is the answer, doctors? Answer is D, abducens nerve. Absolutely correct. This is your clivus. Here you have a sharp turn here into the petrous part of the temporal bone. So here is the petrous part of the temporal bone. Here you will have the clinoid processes. There is a folding of the dura mater in which on the apex of the petrous part of the temporal bone, the abducens nerve takes a sharp turn. The abducens nerve has a very sharp turn here. Alright, याद रखना ये बहुत sharp सा turn है यहाँ पे. Because of that, abducens nerve gets very commonly injured whenever there is an increase in ICP. तुम सोचो उसे हमने एक इतने से कोने से पे लगा दिया और जब ऊपर से प्रेशर पड़ेगा, whenever there is pressure from the top, this will get injured. ठीक है? तो abducens nerve is getting commonly injured here because it lies on the apex of the temporal bone in the Dorello's canal. There is another content of the Dorello's canal. So this was asked in NEET 2015. If it gets repeated, they might ask the other content of the Dorello's canal, and that will be your inferior petrosal sinus. So now you know that inferior petrosal sinus, it pass, you know, two locations where it passes. It passes through the Dorello's canal, and it also passes through the jugular anterior part of the jugular foramen. Question number 12. Cranial nerve related to apex of petrous part of temporal bone. Very clear. Answer is abducens nerve. Answer is going to be abducens. Right. Question 13. Which structure passes through the foramen magnum? Okay, ये structures मैं बार बार इसलिए revise कर रहा हूँ because it is a difficult thing. That is why we are doing around 20 MCQs from these. ताकि you don't forget about these. Which structures pass through the jugular foramen? Oh, sorry, inferior petrosal sinus. Did I say infrapetrosal? Inferior petrosal. Structures passing through the foramen magnum. Which structure passes through the foramen magnum? It is the largest foramen. You must know the contents of foramen magnum. Remember, I told you that the brainstem will obviously pass through it. Around the brainstem, you will have the meninges. So, brainstem, meninges, what else? 13A. Absolutely right. Vertebral artery, and you will also have the vertebral venous plexus, and along with it, you will have the meningeal branches of the vertebral artery. So, answer is A. Absolutely correct. Vertebral artery. Internal carotid artery, carotid canal, hypoglossal nerve, hypoglossal canal. Sympathetic chain starts after coming out of the foramen magnum. It starts after the skull. Okay, it's not present inside, or it does not pass through the foramen. So now it's time to move on. It's time to move on from the whole part of the foramina and do some cranial reflexes. Quickly, let's cover these. Corneal and conjunctival reflex. What happens whenever you try to touch this cornea or conjunctiva? So first tell me, I hope all the questions, all the MCQs are clear. We'll quickly cover these reflexes. One or two more things are left, 2 or 3 MCQs for this. Then we'll do something about the cranial nerve lesions, and then finally optic lesions. Around half an hour more, and then we'll be done. So please tell me if you are clear with everything so far. Nikita, Sagrika, Kuldeep, Akash. Alright. The important cranial nerve reflexes, just listen to me. So you look here, this is your cornea, and you know you have the conjunctiva. So whenever you touch anything here, okay, you have a tendency to blink. You have a tendency to blink, and you have a forceful closure of the eye. Now this closure of the eye will be done by the circular muscle around the eye. That is known as the orbicularis oculi. And since it is a facial muscle, it will be innervated by the facial nerve. So the efferent limb is the facial nerve. No problems? Okay. And the sensory sensations that will be taken by obviously the trigeminal, because this region, remember that diagram, ये वाला trigeminal, then this was maxillary, and this was mandibular. B1, B2, B3, and then this was through the cervical plexus and everything. So this is supplied by ophthalmic nerve. So ophthalmic nerve, sensory sensation. This is clear why it is forming the afferent. Same goes for the lacrimation reflex. Remember, if something goes into your eye, your eye suddenly start watering. So that watering or that tears is through the lacrimal gland. Lacrimal gland is also supplied by the facial nerve. So the efferent will be through the facial nerve, and the afferent will be through the ophthalmic nerve. Oculocardiac reflex. Oculocardiac reflex means if I press the eye very hard, alright, what happens? My heart gets slowed down. That is known as the oculocardiac reflex. Eye massage is done, alright, or carotid massage is also done, anyways. But oculocardiac reflex is this reflex where there is stimulation of vagus by stimulation of the eye. And next we move to the gag reflex. Okay, so gag reflex, what happens? You put your fingers or your hand in your mouth, you will have a tendency to vomit. You will have a tendency to gag. I hope you are mature enough, adult enough to understand what gag is. Okay, so efferent is through the vagus nerve. क्योंकि यहाँ pharynx larynx से आ रहा है ना gag. So efferent will be through the vagus, and afferent is from the posterior 1/3 of the tongue. When you touch the posterior 1/3 of the tongue, and that has its general sensation from glossopharyngeal nerve. 9th and 10th. Carotid sinus reflex is your baroreflex. Glossopharyngeal and vagus will mediate it. Sneezing reflex, chink ana. Whenever something gets stuck in your nose, maxillary and ophthalmic are supplying it. Vagus will cause that sneeze. That is through these branches. Georgic reflex, very important. It is the only monosynaptic reflex. What is a monosynaptic reflex? Where you have one neuron that is efferent and one neuron that is efferent. ठीक है, एक efferent, एक efferent. That is through the jaw-jug masseteric reflex. When you tap the anterior inferior angle of the masseter, you will have mandibular nerve taking the efferent as well as bringing the efferent, which will lead to contraction of the jaw muscles. Okay, that is jaw-jug, and it is used to test the mandibular nerve, trigeminal. So it is used to test your brainstem. Okay, and then you have some pupillary reflexes. We will not go into the detail of that. Proprioceptive impulses. Okay, so question number one from all these reflexes. Proprioceptive impulses for masseter reflex are carried to. Proprioceptive impulses are carried to. Others are polysynaptic, not necessarily. So there is only one synapse. There are two neurons and one synapse. So this is monosynaptic. Others are polysynaptic. They will have a lot of these interneurons in between, and then they will come back. Question number one, proprioceptive impulses for the masseter reflex. What is masseter reflex? The jaw-jerk reflex. They are carried to which nucleus of the trigeminal? The hint here is that it is a pseudo-unipolar neuron. It has a pseudo-unipolar nucleus. No, motor nucleus will be the efferent. Okay, it does not go to the motor nucleus per se. So this is not the correct answer. C is not the correct answer. Proprioceptive impulses. Just think about this diagram. Yes, Mishti is right. Mesencephalic nucleus. So there is a mesencephalic nucleus. There is a spinal nucleus of trigeminal, and there is a chief sensory or pontine nucleus of trigeminal. So the proprioceptive impulses go here to the mesencephalic nucleus. The fine touch and pressure goes to the chief sensory nucleus, and the primitive sensations of pain and temperature, they will go to the spinal nucleus of trigeminal. Okay, so this is obviously present in the midbrain, this is present in the pons, and this will be present in the middle up to the C2 level of spinal cord. Question number 2, which of the following reflexes test the integrity of nucleus ambiguous? Nucleus ambiguous. Question number 2. Absolutely correct, Akash. Gag reflex. How were you able to do this? So gag reflex is mediated through the glossopharyngeal and the vagus. The vagus has its special visceral efferent, that is its motor fibers from the nucleus ambiguous. Remember, nucleus ambiguous is a motor nucleus of the vagus. Okay? And it also has the 9th and the 11th. So the efferent through the glossopharyngeal will come, and then it has to go via the nucleus ambiguous, because this is again a polysynaptic reflex. It will relay in the nucleus ambiguous to interneurons, and then its efferents will go through the vagus, and that is known as the gag reflex. So either the glossopharyngeal or the vagus nerve are damaged, your gag reflex is gone. Then you can put anything you want in the patient's mouth. Yeah, and he will not gag. She will not gag. Question number 3. Center for stapedial reflex. Okay, this I have not taught you. What is the stapedial reflex? Stapedial reflex is you hear a very loud sound and the stapedius muscle contracts. Stapedius muscle contracts so as to prevent excessive vibration of your stapes. And if your stapes vibrates excessively, it will vibrate the oval window, and that will produce very loud sounds that are damaging to your ear. So stapes, the stapedius muscle, it prevents damage to your ears due to very loud sounds. Yes. So 3 का D no. Answer is not medial geniculate body. Although nice guess, but it's not medial geniculate body. बहुत लंबा हो जाएगा फिर बात में अगर medial geniculate body के चला गया. Medial geniculate body से it goes for central processing to the auditory cortex. So it's not medial geniculate body. E is the wrong answer. Akash and Kuldeep. Question का आंसर बताओ. Lateral meniscus? No. Although these are all close guesses, these are all somewhere related to the auditory system. It's a little difficult to answer this, especially since I have not taught you this. Take one more guess, and then obviously you will get to know if wrong or right, and then you will also know the right answer. Okay, so anyways, you probably don't know since you've taken two wrong guesses. So I'll tell you the answer. The answer is superior olivary complex. Answer is superior olivary complex. What happens is, first of all, you should remember that it is a bilateral thing. ठीक है? अगर इस कान में से शुरू हुआ तो इस कान का भी stapedius contract करेगा. So it is a bilateral reflex. No, answer is not inferior colliculus also. Answer is superior olivary complex. देखो इसमें सारे ऑप्शन मिल गए हमें, बट करेक्ट आंसर कुछ और ही निकला. That is the thing about a difficult question. So what is the efferent? The efferent will be through the cranial nerve number 8. Efferent will be through cranial nerve number 8, and then you will have the contraction of stapedius via the facial nerve. So the integrating center is the superior olivary complex, and this is the question that has been asked in the AIMS examination. तो याद रखना superior olivary complex का एक function है stapedial reflex. So now let's move to the cranial nerve lesions. और फैक्ट्री नर्व का लीजन होगा तो क्या होगा? कोविड. कोविड सोचो, कोविड में क्या होता है? लॉस ऑफ स्मेल, एनोस्मिया. ठीक है, ऑल्दो इट्स नॉट रिलेटेड टू olfactory nerve, but loss of smell is obvious. Olfactory nerve function is olfaction, so anosmia. When all it can occur if there's an injury to the cribriform plate or there's a congenital absence of the olfactory. There's an example here called as the Kalman syndrome. So you will read later here that here the hypothalamus is also deficient. So is anosmia and hypogonadism. In optic nerve, you will have visual field effects, can be due to trauma of the orbit or any other lesion. If there is an oculomotor nerve defect, you know that your light reflex is mediated through the oculomotor nerve, Edinger-Westphal nucleus. So first you will have dilated pupils. Pupils won't be able to constrict. There will be ptosis because levator palpebrae superioris is supplied by oculomotor nerve. There will be loss of your normal pupillary reflex. Eyes will move down and out. Why will they move down and out? You can think about the actions of the oculomotor. It can be due to an aneurysm because remember the posterior cerebral and the superior cerebral arteries are closely located to it. It can be due to some herniation or it can be due to a cavernous sinus. Okay, because it is a content of the cavernous sinus. Mnemonic was O Tom Cat. Cochlear nerve, you will not be able to look down inferiorly when the eye is abducted down and in because it supplies the superior oblique. So the clinical example of this is when you are walking down the stairs, you will often fall. क्यों? Because जब stairs से नीचे चलना होता है तो नीचे देखना होता है और इधर इस side को भी देखना होता है ना, down and inward. So you will not be able to do that. और इंसान की गर्दन टेढ़ी हो जाती है to compensate for that. Then you will have the trigeminal. बहुत सारी चीजें होंगी. You will have loss of sensation, loss of motor function of mastication, will not be able to chew, right? Then abducens nerve, you will not be able to move your eye laterally. All right. So that is abducens nerve. Here this can happen around the trigeminal ganglia. This can happen in the cavernous. Facial nerve lesion, you will have paralysis of your facial muscles. You will have abnormal taste sensation from the anterior 2/3 of the tongue because it supplies the taste fibers, gustatory fibers from the anterior 2/3 of the tongue. Then you will have dry conjunctiva. Why? Because it also supplies fiber to the lacrimal gland. And contralateral facial muscle paralysis below the eye. The upper eye is spared because we talked yesterday about the supranuclear and infranuclear lesions. The infranuclear lesions, there is a Supranuclear lesions, there is no sparing, but in supranuclear lesions, there is a sparing. So it depends on the level. Yesterday we talked about facial nerve lesions at 4 levels. कहाँ पे? Geniculate ganglion, chorda tympani, and stylomastoid foramen. Okay, so these will have, the damage can be within the parotid. You can have injury to the temporal bone. You can have viral inflammation. Okay, which causes Bell's palsy, and there can be a brainstem. Then vestibulocochlear nerve, it comes out at the CP angle. So if there is a tumor at the cerebellopontine angle, you will have hearing loss. Tinnitus is कान में टिंग बजता रहता है. Okay, so that ear में ringing sensation, that is vestibulocochlear nerve. Okay, so facial is done, vestibulocochlear is done. Glossopharyngeal, you will have loss of taste from the posterior one third of the tongue because it supplies gustatory fibers to the posterior one third of the tongue. Okay. Then you come to the vagus nerve. You will have soft palate deviation to the normal side, vocal cord paralysis because it supplies the palate, the pharynx, and the larynx. Accessory nerve, I told you, if the lesion is at the nucleus level, you will have paralysis of sternocleidomastoid and trapezius. And if that injury is in the posterior triangle, sternocleidomastoid is spared and trapezius will not be able to function because at that level, accessory nerve has already supplied the sternocleidomastoid. Hypoglossal nerve, you will have atrophy of the ipsilateral muscles and deviation will be towards the affected side. Why? Because the genioglossus, they pull, they don't pull, they push the opposite side. And if the normal side will be able to push the tongue towards the opposite side, and there is a deviation towards the affected side with atrophy of the ipsilateral muscles, you will not be able to speak properly because your tongue is required for phonation. तो क्वेश्चन नंबर 1, इंजरी रेफर्ड पेन से रिलेटेड है ये. ठीक है, थोड़ा सा इसमें सोचोगे तो आंसर आ जाएगा. ईयर से रिलेटेड कौन सी नर्व जाएगी इसमें? रिलेटेड टू द ईयर. One, doctors. Akash, you can write you don't know if you don't know the answer. That I know that I have to explain it directly. Otherwise, I'll wait for you to answer. A or D? Wrong. Both are wrong. So it has to be a mixed or a sensory nerve. It cannot be a motor nerve. Remember, trochlear and abducens nerves, they are purely motor nerves. Don't have much of a sensory supply. The answer is glossopharyngeal. Remember, there was a Jacobson's nerve. I told you that it forms a plexus over the middle ear. It forms a plexus over the middle ear, and that plexus then leaves as the lesser petrosal. That is because of the glossopharyngeal nerve. So it also has some sensation coming from the glossopharyngeal nerve. Yes, Vigneshwaran has given the right answer. The answer is glossopharyngeal. Last portion is your lesions of the facial nerve. Okay, उसके बाद it's more or less done. So think of it this way. Let's do a little. So there is a, basically, if this is your eyeball, This is your eyeball, right? So this is the nasal part. This part is the nasal part, and this part is the temporal part, right? This part is the nasal part, and this part is the. Now, if I look at the visual fields, this temporal part receives light from the nasal side, and this nasal part receives light from the temporal side. Similarly, this will receive the temporal side, and this will receive the nasal side. Okay. So first thing that you have to understand is this. So here you can see left visual field is this, and this is the right visual field. ठीक है, तो दोनों visual field समझ आ गए कौन से क्या है. What is the left visual field and what is the right visual field. Then you have the optic nerves originating from here. The temporal fibers, they do not cross, whereas the nasal or the temporal fibers, they will cross to the opposite side. They will cross to the opposite side. Now, since they are the fibers that cross, there is a crossing here known as the optic chiasma. Then they go here and they relay in the lateral geniculate nucleus. Okay. After that, they have the geniculocalcarine radiations, where you have an upper radiation and a lower radiation. Okay. So this relays here on the calcarine sulcus. You have the upper bank of the calcarine sulcus and the lower bank of the calcarine sulcus. So the upper bank will receive the fibers from the lower half, and the lower bank will receive the fiber from the upper half of the visual field. ठीक है, उल्टा पहुंचता है. So right visual cortex will receive fibers of the left visual field, and the left visual cortex will receive fibers of the right visual field. The upper radiations will be carrying fibers from the lower visual field, and the lower radiations, the lower geniculocalcarine radiations, optic radiations, will be carrying fibers from the upper visual field. Now let's start to cut these. So if I cut the first nerve, so you will have loss of these fibers that are from the right eye. So your entire right eye is gone. Okay, so that is what is happening in 1. In 2, these fibers that were crossing nasally, they were damaged, and they were receiving vision from temporal visual fields. So you will have loss of temporal. So this is known as homonymous hemianopia. Then if the lesion is at this level, the third, so then the left visual field of both eyes is gone. So left दोनों आंखों का गया. फोर्थ में लीजन कहां पे है? इट इज इन द लोअर जेनिकुलोकैल्काइन रेडिएशन. ये लोअर है और ये अपर है. तो लोअर में लीजन हुआ तो अपर गई, एंड ये राइट साइड पे है तो लेफ्ट साइड का अपर है ना. तो लेफ्ट अपर ऑफ both visual fields is gone. Then this and the lesion, if it is further posteriorly present, you will have the same thing with the macular sparing. Now what is the principle of macular sparing? So there is a, you know that there is a macula which is the point of visual acuity, maximum visual acuity. इसमें होता है fovea centralis. But here you have some good vision. So it is supplied by both middle cerebral artery and posterior cerebral artery. So even if, because it is having a very large representation in your visual cortex. So this region of the visual cortex, not the macula, but the region that receives fibers from the visual cortex, is supplied by the middle cerebral artery and the posterior cerebral artery. So since it receives its blood supply from two systems, the middle cerebral and the posterior cerebral, that is why even if the middle cerebral is damaged, the posterior cerebral will allow it to retain its vision. So there is this sparing that is known as macular sparing. ये center वाला usually ठीक रहता है. So guys, I hope you liked my lecture. If you did, please do drop a comment in the comment section and hit like on the like button for this YouTube video. That will really help me. That's the least you can do if you like the lecture. If you have someone in your family or a friend who is planning to take a plus subscription either for NEET PG or UPSC or railways or bank examinations, whatever, and if you are planning to take a subscription for NEET PG, do use my referral code Chetanya10. That is, Chetanya is my name and 10 is the referral code. Subscribe to the channel to get updated here, and my Telegram channel, you can also subscribe it at the rate NEET PG Chetanya. And if you subscribe using my referral code, you will get a 10% discount. Contact me. I will tell you how to use learning credits. You will be able to get an additional 10% off. So that is a total 20% discount. And for using my referral code, I will give you some perks from my end also. So that is three things that you get by using my referral code. Please let me know if you use it. You can contact me on Telegram. You can contact me on Instagram. That is more or less about this. Now, if you want me to give you a quick recap of what we did today, I'll do that. Let's have a 5-minute rundown of the entire cranial nerves. So initially I told you a mnemonic for the cavernous sinus, that was O Tom Cat, right? So that is the first thing that we did. Then move to okay, this promotion. ठीक है, मैंने यहाँ पे कहा था iconic subscription भी ले सकते हो. You'll also get prep ladder. So these are 7 high yield MCQs that I talked about, the longest, shortest, thickest, thinnest, everything. ठीक है. Then I told you these 3 statements which I have discussed in detail today about pharyngeal muscles, tongue muscles, and laryngeal muscles. Then pharyngeal arches, nerve of which pharyngeal arch is which. First is mandibular, second is facial, third is glossopharyngeal, fourth and sixth is vagus and the cranioaccessory complex. This diagram of the brainstem is BTR, Buri Tarah Rato. Brainstem diagram, very important. Cool. Then we move ahead. I talked to you about the columns. I talked to you about which column of which nucleus will have what, and told you to remember this diagram. Very easy once you understand the columns. Then 13th cranial nerve, nervus terminalis, smell mediated sexual behavior. First cranial nerve, olfactory nerve for olfactory sensation, receptor nerve, bulb, tract, strium. Right? Then optic nerve, we have just talked about it. We have talked about its lesions. Third, fourth, and sixth nerve, they will be supplying the extraocular muscles, and they are interconnected by the medial longitudinal fasciculus for conjugate movements. Oculomotor nerve, I told you its course. It comes from the ventral part, goes through the cavernous sinus, divides into superior and inferior, supplies all these muscles, also gives a parasympathetic branch to sphincter pupillae, which is responsible for mediating the light reflex. Trochlear nerves comes out from the dorsal surface, moves contralaterally, also goes through the cavernous sinus, supplies the superior oblique. Abducens nerve goes in the Dorellos canal related to the petroclinoid ligament along with the inferior petrosal sinus, and it will be at the sharp point of the apex of the temporal bone, will supply the lateral rectus. Parasympathetic ganglions, ciliary ganglion, pterygopalatine ganglion, submandibular ganglion, and otic ganglion. Trigeminal nerve has a mesencephalic, principal sensory or pontine, and a spinal nucleus. Ophthalmic and maxillary will be sensory, and mandibular will be mixed. Then you will know through which foramens they are passing. Then we discuss the maxillary nerve V1, maxillary V2. Dismay, you will have the ganglion related to it. You should know which ganglion is related here, pterygopalatine. And then posterior superior alveolar nerves are going middle superior and anterior superior alveolar. It is continuing outside as the infraorbital nerve. Then you have the mandibular nerve coming out of the foramen ovale, dividing into the anterior and posterior divisions, giving direct branches to all the first arch muscles. Important to remember here these tensors. Important to remember here these tensors. Facial nerve, largest intraosseous course. All these nuclei are present, and this diagram is very important for the. Then I told you these various levels of the lesions for the facial nerve. Then we solved a few questions. Vestibulocochlear nerve, I told you its entire course, its entire supply. Glossopharyngeal nerve has all these nuclei, does not have general somatic efferent and special somatic afferent, goes through the jugular foramen, gives a few branches. Then main branches, it gives a muscular branch to stylopharyngeus, and it also gives a tonsillar and lingual branch. Then vagus nerve, jugular foramen, superior ganglion, laryngeal branch, inferior ganglion called the nodose ganglion, moves downward, gives the superior laryngeal nerve, goes to the neck, gives you a recurrent laryngeal nerve. Then we talked about the nerve supply to the pharynx. Remember, right recurrent laryngeal nerve coils around the subclavian artery. Left recurrent laryngeal nerve coils around the ligamentum arteriosum. Right? And this is the supply for the whole larynx. तो गैलेंस एनास्टोमोसिस बताया था रिकरेंट लैरिंजियल नर्व और इंटरनल लैरिंजियल नर्व के बीच में. एक्सेसरी नर्व, क्रेनियल रूट सप्लाइज विद द वेगो एक्सेसरी कॉम्प्लेक्स. स्पाइनल रूट सप्लाइज टू इंपॉर्टेंट मसल्स, sternocleidomastoid, and trapezius. Together, they are present only in the jugular foramen. Before and after the jugular foramen, they are present separately. ठीक है, तो ये हो गया cranial part of accessory का. Then hypoglossal nerve, important is ipsilateral paresis. Important is the fact that it supplies all internal muscles of the tongue except palatoglossus. Gives the superior root of the ancestor bicalis, that is descendens hypoglossi, and supplies two muscles, thyroid and genoid, with the help of C1. Hypoglossal nerve fibers do not innervate them. It is innervated by C1, which merely uses the hypoglossal nerve as to piggyback. ठीक है, and then let's move ahead. हो गया. फोरामिना बता दिए थे सारे इंपॉर्टेंट कौन से हैं इसमें. सुपीरियर ऑर्बिटल फिशर, ऑप्टिक कैनाल, फोरामेन रोटंडम, फोरामेन ओवेल, फोरामेन स्पाइनोसम. निमोनिक भी बताए थे इधर, इनके मेल मैन या फिर ओवेल मैन यूज कर सकते हो. कैरोटिड कैनाल, इंटरनल अकोस्टिक मेटस, जुगुलर फोरामेन में ये भी बताया था कि एंटीरियर से कौन सा है, मिडिल से कौन सा है, पोस्टीरियर से कौन सा है. बेसिकली एंटीरियर पोस्टीरियर एरिया डिवीजन. हाइपोग्लॉसल कैनाल के बारे में बता दिया था, फोरामेन मैग्नम के स्ट्रक्चर्स बता दिए थे. ठीक है, इधर देखना कौन सा इंपॉर्टेंट है. इंसाइसिव फोसा, ग्रेटर पैलेटाइन एंड लेसर पैलेटाइन फोरामेन, इनके आसान है स्ट्रक्चर्स. फोरामेन ओवेल स्पाइनोसम हो चुके हैं, कैरोटिड कैनाल हो चुका है. स्टाइलोमास्टोइड फोरामेन इज इंपॉर्टेंट. ऑलराइट, पेट्रोटिम्पैनिक फिशर इज इंपॉर्टेंट बिकॉज कॉर्डा टिम्पैना इज इंपॉर्टेंट. जुगुलर फोसा इज इंपॉर्टेंट. मास्टोइड नॉट इंपॉर्टेंट. हाइपोग्लॉसल एंड फोरामेन. ठीक है, दिस इज द फोरामेन ओवेल. देन हमने क्या बात कर ली थी. देन वी टॉक्ड अबाउट द रिफ्लेक्सेस ऑफ द हेड एंड नेक. ठीक है, ये सारे रिफ्लेक्सेस इंपॉर्टेंट है, अच्छे क्वेश्चन बन जाते हैं इनसे. इसमें ये याद रखना दैट mesencephalic nucleus receives proprioceptive fibers. It is the only monosynaptic reflex, the jaws of reflex. ठीक है, स्टेपिडियल रिफ्लेक्स का सेंटर सुपीरियर और लाइब्री न्यूक्लियस. Then all these cranial nerve lesions, if you are clear with the functions, there should be no problem in the lesion. Obviously उसका function चला जाएगा. Referred pain in the ear, glossopharyngeal nerve, called the Jacobson's nerve. Visual eye defects, when you will have loss of right visual field, loss of left visual field, and when you will have loss of 1/4 of the vision or the visual field, and when you will have macular sparing. That's all from my side, guys. Please use my referral code Chetanya10 to get a 10% discount. Thank you so much for everyone who watched from the start to end, and thank you so much if you watched this video. I hope you liked the video. I hope you were able to skip through all the pauses, and I hope you were able to watch it on 2x. I hope I was not too fast, not too slow. Please leave your feedback either in the live chat right now or in the comment section. I would really appreciate that. To subscribe to the Let's Crack NEET PG channel, and let me know if anybody is taking a or an iconic subscribe.